Kurumjari. ISTP ngasi yakoi khana na bagi discussion awar mi yang tabiri ba mayam puna mang ahan bada taram no siri ngasi ko na thamdari ba topic se akoi wall cancer day haiba topic sini maram di ngasi se akoi malem go ni yek bada kwaidagi maru ba numising gi manung da amani maram di ngasi February ge tang mari si akoi sahi khudingi wall cancer day haina malem mile pak yana pangthok tuna lakpa adugumba numit amani haijaba tare masigi mari lenana akoi ISTP na sinjara kanda ngasi si wall cancer day haiba topic sida khana na bagi damukta hojik akoi ge studio da hiram masigi the expert mari lengshinuna leibire ahan bada ai mayam da ngasi ge panelisting ma saktak sege ahan boina ai ge hek thanana lengshinun leibiri ba si ai koi Dr. An Iromni associate professor department of medicine Jenims MD DMC clinical hematology ni Dr. Anil Taram Noksari aduga ani suboina leibiri ba sana ai koi tamo Dr. Dhaneswar Sharma akoi senior consultant radiation oncology ni AIO Babina specialty hospital tamo Taram Noksari aduga we have the third panelist. The panelist is Dr. Sivasis Bhattacharya, Senior Consultant Medical Oncology, AIO, Babina Specialty Hospital. Sir, you are welcome to our discussion hour, and thank you very much for joining and giving your valuable time to ISTB Network. Thank you very much. And fourthly, we have the panelist, Dr. Dhaneswar Narem, Consultant Head and Neck Surgical Oncology, AIO, Babina Specialty Hospital, Dr. Sutaram Oksari. So, moving on the discussion on the topic, the World Cancer Day. So, firstly, I would like to discuss my first point with Sir Sivasis Bhattacharya. So, today, as I have said in Manipuri, that today is very memorable and very important day of the world because it is the day of the observance of the World Cancer Day. Every year, we all know that the 4th of February is observed as the World Cancer Day. So, as a part of this, in some part of the Manipur, today also this observance was also done. And in connection with this, the first point that I would like to discuss with you is that what is the World Cancer Day? And what's the reason behind this observance of the World Cancer Day? And what is the theme of this very year 2024, sir?
Kurungjari, namaste. World Cancer Day is actually a observance for dedicating the nation's resources, world's resources towards the prevention and treatment of cancer. It all started in 2000 in Paris. There was a conference of Union of International Cancer Control, UICC, and they declared February 4th, the day of their conference. Henceforth, for last 23 years, it is the 24th year, it is being observed as a World Cancer Day. Every day, we, the doctors treating cancer and the patients suffering from cancer and their caregiver family members are striving, and this is the day on which we rededicate ourselves for the betterment of the care. And especially what you have asked, this is the from 2022 to 24, it is the same slogan or theme, that is close the care gap.
Close the
Care gap. Care gap. Though there is definitely a gap in the delivery of the care to the cancer patients. What is expected as per the best scientific evidence is not available to the patients all the places in all the areas of the world. So to close this gap, what we can do both from government and from the corporate sector and from the different non-governmental organization. So that is the time when we come together and help each other to close the gap in access. Most important is the access to cancer care.
Okay, sir. So the theme is close the gap, close the care gap. So why is given? Is there any disparities in the world?
Yes, there is a lot of disparities. Most important and important issue here is the cancer incidence is more in the low socioeconomic and middle income countries compared to the high socioeconomic countries. So incidence is higher and mortality is also higher in low socioeconomic country. But actually here diagnosis is not done. So as per the international registry data, we find that our cancer rates are much lower. Most common cancer is lung cancer worldwide. Age adjusted ratio in India, all Indian registries, They are all realistic figure, but they do not come under the registry system because of the lack of collection of data. But our mortality is quite high. So for each breast cancer or lung cancer patient detected, our case fatality rate, that means number of patient diagnosed versus number of patients saved from the cancer, life saved, is much less. Rather, mortality is quite high. So this is due to gap in the care. And this gap is all pervasive across the socioeconomic status, across the cultural status and everything. So in all parts of the nation, and especially in the northeast, the cancer burden is much more compared to the rest of the nation. So here we need more emphasis on the awareness so that early diagnosis can be reached and cancer care can be made accessible to all of the population. Like 35 million population in Manipur. It is a relatively smaller nation, a smaller state, but compared to the population, number of cancer patient is much higher. It is second to just Mizoram. Mizoram has the highest number, followed by Manipur.
Sir, you also mentioning about the socio-economic status of Manipur. We all know that the economic condition of Manipur is not sound. So the burden of this devastating disease, cancers, is faced by many people regardless of their low-income family or high-income family. So are there any ways through which the people, especially the cancer survivors, can get at least some aids either from the government or policy makers or NGOs or say cancer organizations?
So it is very important question. All the states have a population who are low socioeconomic condition. So Manipur is not an exception to that. Socioeconomically, it is not a very, it is a small state, but it is not very backward state, to be precise, economically. But issue is the access to care. All facilities are restricted to a particular city. Rest of the city, which are maybe distance-wise few kilometers, but the time taken to travel and all other issues are there. So in spite of all these barricades, people when reach the capital city of Imphal, they also face some problem, where to go, where will get the best care. So these are the problems, and these can only be changed by increasing the awareness. So nowadays you will be happy to note that all the central government and state government schemes called Chief Minister Health Scheme, CMHT and PMJY, Ayushman Bharat program. So all these are available to the poorest of the poor family through the provision of a free card. So it is a step towards the universal health care program, I believe. So that means no patient, no individual is devoid of that facility. So he definitely has an insurance of 5 lakhs. So how to utilize that 5 lakhs for the cancer care and how we can corroborate with the government principles and our service providers like different hospitals, both government and private sector. So that is the most important issue, and that's how we can close the gap better.
CMHT and PMJY card might be in the hands of some people, but due to the financial stringency and the financial constraint, people are lack to access to the treatments of this cancer.
If that card is available, the treatment is available in all the hospitals free of cost, barring few very costly medications and few investigations like that. Other than that, within that card coverage, every poor man can get the facility, and only thing is he has to access the nearest people representative to get the card at the earliest. So I should give the message, one message clear, that if you have that card, it is an insurance, it is a 5 lakh rupee check to you for cancer care.
Sir, I would like to discuss more in the next round. Thank you very much for the first round. Tamo Danesor Damu Laksege. Tamo Hajiksi Aquina Mayam Si Hoi Laina Makan Mayam Malay. ꯃꯁꯤꯅ ꯃꯔꯝ ꯑꯣꯏꯔꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯁꯤ ꯀꯦꯟꯁꯔ ꯈꯛꯇ ꯅꯠꯇꯕ ꯑꯇꯣꯞꯄ ꯃꯈꯜ ꯃꯌꯥꯝ ꯑꯃꯁꯨ ꯃꯁꯤꯅ ꯃꯔꯝ ꯑꯣꯏꯔꯒ ꯃꯤꯁꯤ ꯑꯁꯤ ꯑꯅꯥꯁꯤꯗ ꯌꯥꯎꯔꯤꯅ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯨꯕꯨ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯕ ꯂꯥꯏꯅꯥ ꯑꯁꯤ ꯃꯤꯅ ꯍꯦꯛ ꯇꯥꯕꯗ ꯀꯤꯕ ꯐꯥꯎꯕ ꯑꯗꯨꯒꯨꯝꯕ ꯃꯈꯜꯒꯤ ꯗꯤꯚꯥꯁꯇꯤꯡ ꯗꯤꯖꯤꯁ ꯍꯥꯏꯕ ꯇꯥꯔꯦ ꯑꯗꯨꯒꯨꯝꯕ ꯑꯃ ꯑꯣꯏꯅꯗꯤ ꯍꯧꯖꯤꯛꯁꯦ ꯂꯧꯅꯕ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯧꯖꯤꯛ ꯉꯁꯥꯏ ꯅꯣꯔꯠ ꯏꯁꯀꯤꯗꯗꯤ ꯈꯔ ꯍꯥꯏꯕꯤꯈ꯭ꯔꯦ ꯑꯗꯣ ꯑꯩꯈꯣꯏ ꯀꯦꯟꯁꯔꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯥꯏꯞꯁꯤꯡꯁꯤ ꯀꯔꯝꯃꯥꯏꯅ ꯍꯧꯖꯤꯛꯀꯤ ꯇꯧꯏ ꯑꯗꯨꯒ ꯃꯅꯤꯄꯨꯔꯗ ꯑꯩꯈꯣꯏ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯒꯤ ꯃꯇꯥꯡꯁꯤꯅ ꯀꯔꯝꯕ ꯁ꯭ꯇꯦꯇꯁꯇ ꯑꯩꯈꯣꯏ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯀꯣꯟꯇꯦꯛꯁꯇ ꯌꯦꯡꯕꯗ ꯂꯩꯔꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯅꯥꯕꯒꯤ ꯆꯥꯡꯁꯤꯅ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯤ ꯀꯔꯝꯕ ꯃꯈꯜꯁꯤꯡꯁꯤ ꯐꯪꯏ ꯍꯥꯏꯕ ꯁ꯭ꯋꯥꯏꯒꯤ ꯏꯟꯇ꯭ꯔꯣꯗꯛꯇꯔꯤ ꯃꯥꯒꯤ ꯈꯔ ꯃꯔꯨꯑꯣꯏꯕ ꯃꯌꯥꯝꯅ ꯈꯪꯕ ꯗꯔꯀꯥꯔ ꯃꯊꯧ ꯇꯥꯕꯁꯤꯡꯁꯦ ꯇꯥꯃꯣ ꯁ꯭ꯋꯥꯏꯗ ꯑꯍꯥꯟꯕ ꯔꯥꯎꯟꯁꯤꯗ ꯊꯝꯕꯤꯌꯨ
ꯑꯍꯥꯟꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔꯗ ꯀꯦꯟꯁꯔꯁꯤ ꯑꯩꯒꯤ ꯑꯦꯛꯁꯄꯤꯔꯤꯌꯦꯟꯁ ꯑꯦꯟ ꯅꯣꯂꯦꯖ ꯑꯦꯕꯥꯏꯂꯦꯕꯜ ꯅꯣꯂꯦꯖꯀꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯑꯣꯔ ꯏꯟꯐꯣꯔꯃꯦꯁꯟꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯆꯥꯎꯔꯥꯛꯅ ꯃꯅꯤꯄꯨꯔꯗ ꯀꯦꯟꯁꯔꯁꯤ ꯑꯅꯧꯕ ꯀꯦꯁꯁꯤ 2,000 ꯐꯥꯅꯤꯡꯆꯦꯠ ꯂꯥꯛꯄ ꯍꯧꯔꯦ ꯍꯧꯖꯤꯛꯁꯦ ꯍꯥꯟꯅ ꯆꯍꯤ 10 ꯃꯃꯥꯡꯗ 1,000 ꯌꯧꯔꯝꯗꯦ ꯑꯗꯣ ꯍꯧꯖꯤꯛꯇꯤ 2,000ꯒꯤ ꯃꯌꯥ ꯅꯛꯁꯤꯜꯂꯛꯑꯦ
ꯃꯇꯝꯗꯨꯒ ꯍꯥꯏꯕꯤꯔꯣ
ꯃꯇꯝꯁꯤ ꯑꯦꯔꯥꯎꯟ 2010 8 9 ꯑꯗꯨꯋꯥꯏꯗ 1,000 ꯌꯧꯗꯦ ꯑꯦꯔꯥꯎꯟ 900 ꯀꯨꯝꯕ ꯂꯩꯔꯝꯃꯦ ꯑꯗꯣ ꯍꯧꯖꯤꯛ ꯑꯩꯒꯤ ꯄꯦꯁꯦꯟꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯤꯌꯔꯒꯤ ꯑꯦꯛꯁꯄꯤꯔꯤꯌꯦꯟꯁꯁꯦ ꯆꯍꯤ 22 ꯑꯃꯨꯛ ꯁꯨꯖꯜꯂꯛꯑꯕꯅꯤ나 ꯑꯩꯅ ꯁꯤꯒꯤ ꯇ꯭ꯔꯦꯟ ꯑꯃꯈꯛ ꯑꯩꯅ ꯑꯣꯕꯖꯥꯔꯕ ꯇꯧꯖꯩ ꯑꯗꯣ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯧꯖꯤꯛ ꯌꯥꯝ ꯍꯦꯟꯅ ꯍꯦꯟꯒꯠꯂꯦꯅ ꯑꯩ ꯂꯧꯖꯩ ꯑꯗꯨꯒ ꯍꯧꯖꯤꯛ ꯑꯣꯏꯅ ꯃꯅꯤꯄꯨꯔꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔ ꯔꯦꯖꯤꯁꯇ꯭ꯔꯤꯁꯨ ꯂꯩꯔꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯣꯄꯨꯂꯦꯁꯟ ꯕꯦꯁ ꯀꯦꯟꯁꯔ ꯔꯦꯖꯤꯁꯇ꯭ꯔꯤꯒꯤ ꯌꯥꯝ ꯑꯦꯀꯨꯔꯦꯠ ꯅꯝꯕꯔꯁꯨ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯝ ꯂꯣꯏꯅ ꯍꯧꯖꯤꯛ ꯑꯦꯕꯥꯏꯂꯦꯕꯜ ꯑꯣꯏ ꯑꯗꯣ ꯆꯥꯎꯔꯥꯛꯄ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔ ꯄꯦꯁꯦꯟꯁꯤꯗ ꯈ꯭ꯋꯥꯏ ꯀꯃꯟ ꯑꯣꯏꯕꯁꯤ ꯅꯨꯄꯥꯗ ꯂꯪ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯧꯖꯤꯛꯁꯨ ꯑꯗꯨꯝ ꯀꯃꯟ ꯑꯣꯏ ꯂꯩꯔꯤ ꯍꯥꯟꯅ ꯆꯍꯤ 10ꯒꯤ ꯃꯃꯥꯡꯗ 15 ꯃꯃꯥꯡꯗ ꯅꯝꯕꯔ 1ꯗ ꯂꯩꯕ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯧꯖꯤꯛꯁꯨ ꯑꯗꯨꯝ ꯅꯨꯄꯥ ꯃꯦꯜ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯦꯁꯦꯟꯁꯤꯡꯁꯤꯗ ꯑꯗꯨꯝ ꯅꯝꯕꯔ 1ꯗ ꯂꯩꯕ ꯍꯟꯊꯕ ꯂꯩꯇꯦ ꯑꯗꯨꯒ ꯍꯦꯗ ꯑꯦꯟ ꯅꯦꯛ ꯀꯦꯟꯁꯔꯁꯤ ꯌꯥꯝꯅ ꯑꯗꯨꯝ ꯋꯥꯡꯉꯤ ꯑꯗꯨꯒ ꯏꯁꯇꯣꯃꯥꯛ ꯀꯦꯟꯁꯔ ꯏꯁꯣꯐꯦꯖꯤꯌꯦꯜ ꯀꯦꯟꯁꯔ ꯍꯧꯖꯤꯛꯁꯦ ꯑꯌꯥꯝꯕ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯥꯟꯅꯒ ꯑꯃꯨꯛ ꯆꯦꯟꯖ ꯑꯃ ꯂꯥꯛꯄꯁꯤꯅ ꯍꯧꯖꯤꯛꯁꯤꯅ ꯑꯩꯈꯣꯏ ꯆꯥꯕ ꯊꯛꯄꯒ ꯃꯩ ꯂꯩꯅꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯐꯨꯗ ꯄꯥꯏꯞꯀ ꯃꯩ ꯂꯩꯅꯕ ꯈꯅꯥꯎꯗꯒꯤ ꯍꯧꯅ ꯑꯩꯈꯣꯏ ꯆꯥꯛꯈꯧ ꯇꯥꯕꯁꯦ ꯁꯤꯒ ꯃꯩ ꯂꯩꯅꯕ ꯖꯒꯥꯁꯤꯗ ꯀꯦꯟꯁꯔꯁꯦ ꯍꯦꯟꯒꯠꯂꯛꯑꯦ ꯅꯨꯄꯥꯁꯤꯡꯗ ꯑꯗꯨꯒ ꯅꯨꯄꯤꯗꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯧꯖꯤꯛ ꯅꯝꯕꯔ 1ꯅꯤ ꯑꯗꯨ ꯁꯔꯚꯥꯏꯀꯦꯜ ꯀꯦꯟꯁꯔꯁꯤ ꯍꯥꯟꯅ ꯋꯨꯝ ꯀꯦꯟꯁꯔꯅ ꯃꯌꯥꯝꯅ ꯈꯪꯅꯕꯁꯤ ꯌꯥꯝ ꯋꯥꯡꯉꯝꯃꯤ ꯆꯍꯤ 10 ꯃꯃꯥꯡꯗ 13ꯀꯤ ꯃꯃꯥꯡꯗ ꯌꯥꯝ ꯋꯥꯡꯉꯝꯃꯤ ꯍꯧꯖꯤꯛꯇꯤ ꯋꯨꯝ ꯀꯦꯟꯁꯔꯁꯤ ꯈꯤꯇꯪ ꯍꯟꯊꯔꯦ ꯑꯗꯨꯒ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔꯁꯤ ꯅꯝꯕꯔ 1ꯗ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯌꯥꯝ ꯊꯥꯖꯗꯕ ꯑꯃꯅ ꯅꯨꯄꯤꯁꯤꯡꯗꯁꯨ ꯂꯪ ꯀꯦꯟꯁꯔꯁꯤ ꯑꯗꯨꯝ ꯋꯥꯡꯉꯦꯕ ꯃꯅꯤꯄꯨꯔꯗ ꯁꯤ ꯁ꯭ꯃꯣꯀꯔ ꯑꯣꯔ ꯅꯟ ꯁ꯭ꯃꯣꯀꯔ ꯍꯥꯏꯕ ꯑꯗꯨꯝ ꯋꯥꯡꯉꯤ ꯑꯗꯨꯒ ꯃꯔꯨꯑꯣꯏꯅ ꯅꯨꯄꯤꯗ ꯍꯧꯖꯤꯛ ꯒꯣꯜ ꯕ꯭ꯂꯦꯗꯔ ꯀꯦꯟꯁꯔ ꯑꯣꯚꯦꯔꯤꯌꯟ ꯀꯦꯟꯁꯔꯁꯦ ꯁꯤꯃ ꯑꯗꯨꯝ ꯋꯥꯡꯅ ꯂꯩꯔꯤ ꯑꯗꯨꯒ ꯏꯊꯥ ꯊꯥꯖꯗꯅ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔꯁꯤ ꯌꯥꯝ ꯋꯥꯡꯉꯤ ꯅꯨꯄꯤꯗ ꯑꯗꯣ ꯃꯅꯤꯄꯨꯔꯗ ꯍꯧꯖꯤꯛ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔꯒꯤ ꯏꯁꯨ ꯑꯃ ꯌꯥꯝ ꯋꯥꯡꯈꯠꯂꯛꯏ ꯑꯗꯣ ꯁꯤꯒꯤ ꯀꯦꯟꯁꯔ ꯃꯈꯜꯁꯤꯅ ꯑꯌꯥꯝꯕ ꯀꯃꯟ ꯑꯣꯏꯕ ꯀꯦꯟꯁꯔ ꯑꯣꯏꯔꯦ ꯑꯗꯨꯒ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯒꯤ ꯃꯇꯥꯡꯗꯗꯤ ꯑꯩꯈꯣꯏ ꯀꯦꯟꯁꯔ ꯂꯥꯌꯦꯡꯕ ꯃꯇꯝꯗ ꯍꯥꯟꯅ ꯑꯩꯈꯣꯏꯅ ꯗꯦꯇꯥ ꯑꯃꯗ ꯏꯆꯝ ꯆꯝꯅ ꯍꯥꯏꯖꯒꯦ ꯀꯦꯟꯁꯔ ꯀ꯭ꯌꯣꯔꯁꯤ ꯔꯦꯗꯤꯌꯦꯁꯟ ꯊꯦꯔꯥꯄꯤꯅ 40% ꯉꯝꯃꯤ ꯁꯔꯖꯔꯤꯅ 49% ꯉꯝꯃꯤ ꯍꯥꯏꯕꯅꯆꯤꯡꯕ ꯗꯦꯇꯥ ꯃꯌꯥꯝ ꯂꯩꯖꯔꯒꯁꯨ ꯀꯦꯟꯁꯔ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯍꯥꯏꯕꯁꯤ ꯁꯤꯡꯒꯜ ꯃꯣꯗꯦꯂꯤꯇꯤ ꯅꯠꯇꯦꯕ ꯃꯜꯇꯤꯄꯜ ꯃꯣꯗꯦꯂꯤꯇꯤꯅꯤ ꯃꯥꯗꯤ ꯀꯝꯕꯤꯅꯦꯁꯟꯅꯤ ꯁꯔꯖꯔꯤ ꯍꯥꯟꯅ ꯇꯧꯕ ꯑꯣꯔ ꯔꯦꯗꯤꯌꯦꯁꯟ ꯍꯥꯟꯅ ꯇꯧꯕ ꯅꯠꯇ꯭ꯔꯒ ꯀꯦꯃꯣꯊꯦꯔꯥꯄꯤ ꯂꯥꯛꯄ ꯁꯤꯒꯤ ꯀꯝꯕꯤꯅꯦꯁꯟꯁꯤꯗ ꯆꯠꯂꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀ꯭ꯌꯣꯔꯒꯤ ꯑꯦꯇꯦꯝꯁꯨ ꯇꯧꯅꯕ ꯑꯗꯨꯅ ꯀꯦꯟꯁꯔ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯗ ꯁꯤꯡꯒꯜ ꯃꯣꯗꯦꯂꯤꯇꯤ ꯑꯃꯠꯇꯅ ꯗꯣꯃꯤꯅꯦꯠ ꯇꯧꯗꯦ ꯂꯣꯏꯅ ꯄꯨꯟꯁꯤꯜꯂꯒ ꯇꯧꯕꯅꯤ ꯑꯗꯨꯅ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯃꯔꯨꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔ ꯂꯥꯌꯦꯡꯕꯗ ꯁꯔꯖꯔꯤ ꯄꯥꯔꯠꯁꯦ ꯃꯔꯨ ꯑꯣꯏ ꯀꯦꯟꯁꯔꯁꯤ ꯂꯩꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏ ꯌꯥꯔꯤꯕ ꯃꯈꯩꯗꯤ ꯁꯔꯖꯔꯤ ꯇꯧꯊꯣꯛꯑꯒ ꯀꯦꯟꯁꯔꯁꯤ ꯂꯧꯊꯣꯛꯈꯤꯕ ꯕꯣꯗꯤꯗꯒꯤ ꯃꯗꯨ ꯂꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯤꯠ ꯎꯕ ꯉꯝꯗꯕ ꯂꯩꯍꯧꯕ ꯌꯥꯏꯅ ꯈꯜꯂꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯔꯦꯗꯤꯌꯦꯁꯟ ꯈꯤꯇꯪ ꯉꯁꯥꯏꯒꯤ ꯁꯔꯖꯔꯤ ꯇꯧꯕ ꯃꯐꯝꯁꯤꯗ ꯄꯤꯁꯜꯂꯒꯗꯤ ꯑꯅꯥꯕꯁꯦ ꯑꯃꯨꯛ ꯍꯧꯔꯛꯇꯕ ꯌꯥꯕꯒꯤ ꯆꯥꯟꯁ ꯂꯩꯕ ꯑꯗꯨꯒ ꯑꯃꯨꯛꯁꯨ ꯀꯦꯟꯁꯔꯁꯤꯅ ꯑꯩꯈꯣꯏ ꯏꯗ ꯆꯠꯈ꯭ꯔꯒ ꯇꯨꯡꯗ ꯂꯪꯁꯇ ꯂꯤꯚꯔꯗ ꯕ꯭ꯔꯦꯟꯗ ꯂꯥꯛꯄꯒꯤ ꯆꯥꯟꯁꯁꯤ ꯂꯩꯔꯦ ꯍꯥꯏꯔꯒꯗꯤ ꯀꯦꯃꯣꯊꯦꯔꯥꯄꯤꯒꯨꯝꯕ ꯇꯥꯔꯒꯦꯇꯦꯗ ꯊꯦꯔꯥꯄꯤ ꯃꯈꯜ ꯂꯩꯈ꯭ꯔꯦ ꯃꯁꯤ ꯃꯌꯥꯝ ꯊꯥꯗꯕ ꯌꯥꯗꯦ ꯑꯗꯨꯅ ꯍꯥꯏꯔꯤꯕ ꯃꯣꯗꯦꯂꯤꯇꯤ ꯃꯌꯥꯝꯁꯤ ꯀꯝꯕꯤꯅꯦꯁꯟ ꯑꯣꯏꯅ ꯑꯩꯈꯣꯏ ꯆꯠꯀꯅꯤ ꯑꯗꯨꯒ ꯄ꯭ꯔꯣꯇꯣꯀꯣꯜ ꯑꯃꯒꯤ ꯃꯈꯥꯗ ꯏꯕꯤꯗꯦꯟꯁ ꯕꯦꯁ ꯑꯣꯏꯕ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜꯒꯤ ꯄ꯭ꯔꯣꯇꯣꯀꯣꯜ ꯑꯃꯒꯤ ꯃꯈꯥꯗ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤ ꯇꯧꯕꯅꯤ ꯗꯣꯛꯇꯔ ꯑꯃꯒ ꯖꯣꯏꯟ ꯀ꯭ꯂꯤꯅꯤꯛ ꯐꯖꯅ ꯇꯧꯔꯒ ꯄꯦꯁꯦꯟꯗꯨꯒꯤ ꯑꯣꯏꯕ ꯄꯥꯔꯇꯤꯀꯨꯂꯔ ꯄꯦꯁꯦꯟꯗꯨꯒꯤ ꯄ꯭ꯔꯖꯦꯟꯇꯦꯁꯟꯗꯨ ꯑꯩꯈꯣꯏꯅ ꯁ꯭ꯇꯗꯤ ꯇꯧꯔꯀꯥꯟꯗ ꯁꯤꯒꯤ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯤꯅ ꯍꯥꯟꯅ ꯇꯧꯕꯅ ꯐꯩ ꯑꯣꯔ ꯂꯦꯇꯦꯁ ꯏꯟꯐꯣꯔꯃꯦꯁꯟꯗ ꯁꯤꯅ ꯍꯦꯟꯅ ꯐꯔꯦ ꯍꯥꯏꯕꯆꯤꯡꯕ ꯀꯔꯦꯟ ꯑꯦꯐꯤꯌꯔꯁꯦ ꯑꯩꯈꯣꯏ ꯈꯪꯗꯕ ꯌꯥꯗꯦꯕ ꯑꯞꯗꯦꯠ ꯃꯌꯥꯝꯁꯦ ꯑꯗꯨꯅ ꯍꯧꯖꯤꯛ ꯃꯅꯤꯄꯨꯔꯗ ꯁꯤꯒꯤ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯤ ꯑꯩꯈꯣꯏꯗ ꯆꯥꯎꯔꯥꯛꯄ ꯃꯦꯛꯁꯤꯃꯝ ꯑꯩꯈꯣꯏ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯤ ꯑꯃꯦꯔꯤꯀꯥꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤꯗꯗꯤ ꯑꯩꯈꯣꯏ ꯍꯧꯖꯤꯛ ꯂꯩꯔꯦ ꯑꯩꯈꯣꯏꯗ ꯁꯔꯖꯔꯤ ꯑꯣꯟꯀꯣꯂꯣꯖꯤꯒꯤ ꯋꯤꯡ ꯌꯥꯝ ꯐꯖꯅ ꯂꯩꯔꯦ AOIꯗ ꯑꯣꯟꯀꯣ ꯁꯔꯖꯔꯤꯁꯤ ꯍꯦꯗ ꯑꯦꯟ ꯅꯦꯛꯀꯤꯁꯨ ꯑꯩꯈꯣꯏ ꯗꯣꯛꯇꯔ ꯌꯥꯎꯕꯤꯔꯤ ꯑꯩꯈꯣꯏ ꯁꯔꯖꯔꯤ ꯄꯥꯔꯠ ꯂꯩꯔꯦ ꯑꯗꯒꯤ ꯔꯦꯗꯤꯌꯦꯁꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯤꯝ ꯐꯖꯅ ꯂꯩ ꯑꯗꯒꯤ ꯃꯤꯗꯤꯌꯥ ꯑꯣꯟꯀꯣꯂꯣꯖꯤꯁꯀꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯤꯝ ꯗꯤꯄꯥꯔꯠꯃꯦꯟ ꯐꯖꯅ ꯂꯩꯔꯦ ꯄꯦꯠ ꯁꯤꯇꯤ ꯁ꯭ꯀꯦꯟ ꯍꯥꯏꯕꯁꯤ ꯌꯥꯎꯗꯅ ꯀꯦꯟꯁꯔ ꯁꯦꯟꯇꯔ ꯑꯃ ꯔꯟ ꯇꯧꯕ ꯌꯥꯗꯦ ꯑꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯃꯦꯔꯤꯀꯥꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤꯗ ꯄꯦꯠ ꯁꯤꯇꯤꯒꯤ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯤ ꯌꯥꯝ ꯐꯖꯅ ꯂꯩ ꯑꯗꯨꯅ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯄꯨꯟꯁꯤꯜꯂꯒ ꯑꯩꯈꯣꯏꯅ ꯖꯣꯏꯟ ꯀ꯭ꯂꯤꯅꯤꯛ ꯑꯃ ꯏꯟꯇꯔꯅꯦꯁꯅꯦꯜ ꯇ꯭ꯌꯨꯃꯔ ꯕꯣꯔꯗꯅꯆꯤꯡꯕ ꯑꯩꯈꯣꯏ ꯋꯤꯛꯂꯤ ꯇꯧꯔꯒ ꯀꯦꯁꯁꯤꯡꯁꯦ ꯈꯪꯒꯠꯂꯒ ꯃꯔꯨꯑꯣꯏꯕ ꯀꯦꯁꯁꯤꯡꯁꯦ ꯑꯩꯈꯣꯏ ꯈꯟꯅꯔꯀꯥꯟꯗ ꯑꯩꯈꯣꯏ ꯈꯨꯠ ꯊꯥꯏ ꯍꯥꯟꯅ ꯍꯦꯛꯇ ꯄꯦꯁꯦꯟꯁꯦ ꯂꯥꯛꯄ ꯑꯩꯈꯣꯏ ꯈꯨꯠ ꯊꯥꯕ ꯌꯥꯗꯦ ꯑꯦꯄ꯭ꯔꯨꯚꯦꯜ ꯂꯧꯒꯅꯤ aduga patient ji akhoi na mayam ge yana ba treatment protocol da chalaga layeng bani adna hojik masigi ahamba evidence based gi modern gi oiba hoigi hojikan gi mayam chanari ba achouba city da chanari ba treatment tobagi mawong se hoi manipur da hojik hoi lakpa hore aduga american oncology da di hoi hek hangbaga si poche adum direct adoption hoi tawhrabani protocol da hoi di system ja dum chachayebako adno hojik phogi ori di hoi nangam seba mayam changna dum honari
okay yam waje da mathang na dum laksige ai koi kano da mulaksige doctor anil da mulaksige doctor koi hajik se cancer si masigi warning sign haibatare masigumba si adum sojan leiram gadu male masi maru we basing si kari kari no adum masi karamaina thoglai aduga masi prevention tawba yaba koi lamben sing si leiram gani na khal haitare swagi matang sida ahan ba chi thambiro
hojiki hariba topic se yam maru oi adubu marak thana karigum amtang haijaramge ngoi ngasai discussion da hangbi ba ngasi bokta patient jing da kari kari government gi side gi khudong jaba phangge habji matang de edition amtang haijaramge chief minister gi haksel gi tengbang PMJY sidi ayamana loi khangnare sigi mathakta ama hojik yam kana jenims ta khoina medicine gi department gi makha da ai je akoi gi medicine gi doctor su oijaraga hematology oina su yengjaraga hemato-oncology su pun yengjabane Prime Minister Relief Fund haiba fund makhak leye masigi fund jida aina patient jigi changgadaba pesa je lupa lakh tara changgani hairagadi akoina laina sigi matungina laina se akoina okay magi anabaje sini magi treatment je sini hana che je detail de iraga akoi gi che sang khradi changi che sang jigi mayam ji yamna aruba che chang dinate akoi gi affidavit kuma ma chagani akoi gi Manipur gi MP de gi soiloi ayambana di Manipur gi de akoi ining thongna ayamba pi hujigi soise aduga masi akoi gi nirman bhavan da the Tharaga usually within 3 months the process Taraga, Cheese Europe, the 6 month Mukti Change. Moina sanction the Roko Pesa, Quina Lak, Manga Hydro, the Lak, and Makai Humpire. Adigi, when Hen is a Loroga di Moyum Piraro. What need a gadi Mangzare Quita, Duna Quina Kitang, Chan Igiba. Other thing a Sibok Takogi Pesa, Aina some Ningsang Bada, when Amster, Tamapamatam, the Yam Sine, Aduna in a Kangiba. Money put us the Pesa Pai the Mam, Duna. Lying but so what if they Kari Marangi combined to the Pangatagi and Masi quite antanak, but Hojikti successfully acquay Zenimsta, Masiki Kutong Chabzemi, whom Drama Mukti Pangre, Masi Pesazi, patient Siki Mulo Hidaxi Layraga, patients in a reimbursed woman, I Hidaxil Palacing Kunmanging Si Changre, Haragadi, Aina Ibachetuga, Aina receipt to the Soitoraga, a Hoigi Moigi Pesazi, medical superintendent, account the Lakani, superintendent Siki Muxin of Zadi, at the mind of the Nasagi. Chief Minister Haksel Tengbang PMJY gi mathakta Prime Minister Relief Fund haibase masigi khudong jaba lobi ho masi khudong jaba se asuki madik kani masi AOI na so soidana lobi yagani na ina khanje aduga so coming to the akoi gi hujiki question je warning sign hairagadi akoi na cancer hairagadi warning sign akoi na thaina dagi khangnarak base laiho yam toren khalase laiho to base laiho gi asuki madik makhal yam gore any infection azu laiho to boye typhoid na azu laiho to we dengue na azu laiho to we to cancer gi lai hausi na kitang tongale lai hause ayukta mu hek lak pugumba nungdang atheng bada hek lak pugumba full day di lakta ba khara kuina lakpa tharom da sum lakpa hapta amagumba ni gumba sum sangdorok pa haitar weight sum handarak pa haitar magi arumbagi changje phiron ga sum kom tharak pa khoi weighing machine leitaba mamam lei weighing machine leitragadi olude tawdo phiron ga je kom tharak pa khoi chairum ga je kupsalak pa adigi di mathang da khoi gi hakchang da ngak kumba kai gumba da natraga hakchang da pom khot pa torok pa dum togalle kana gumba na khoi gi pome da na hena pakhat pa ya de tawdo pomla agadi hairiba pom buduna khoi chingna bam di leire khanguni na khoi na madu section be mathang da khoi puk kumba se khoi oirom da spleen heba organam leye masigi spleen heba pose hek pom ba yawgale maruina blood ta aina blood ki specialist oirom ni na blood rom da di khar changchal lai gi se tawdo bu spleen je pom agadi puk se hek na bu gumba kai gumba tawgale mathang da khoi gi kari gumba ngasai stomach cancer gana hai gibdo khong hambada I hek yawbugumba obada I hek yawbugumba I gese handarak bagi hakchang yam choktharak pa haitare I je walab ni hakchang yam choktharak pa mathangda akhoi gi ulcer haite any jaga da ulcer je ya manung da akhoi gi tat khreba ꯁꯨꯡꯑꯣꯏ ꯑꯣꯏꯁꯜꯂꯨ ꯌꯥꯗ꯭ꯔꯦꯕ ꯑꯩꯈꯣꯏꯁꯨ ꯌꯥꯗ ꯇꯠꯂꯦ ꯉꯔꯥꯡ ꯅꯍꯥꯟ ꯇꯠꯂꯦ ꯑꯗꯣ ꯍꯧꯖꯤꯛ ꯑꯩ ꯀꯩꯝ ꯇꯧꯗ꯭ꯔꯦ ꯀꯥꯎꯈ꯭ꯔꯦ ꯇꯧꯕꯗꯨꯕꯨ ꯀꯅꯥꯒꯨꯝꯕ ꯑꯃꯅ ꯑꯩꯒꯤ ꯌꯥꯔꯤ ꯌꯥꯈꯣꯡꯁꯦ ꯁꯨꯝ ꯇꯠꯂꯤꯗ ꯃꯁꯤ ꯍꯞꯇꯥ ꯍꯦꯟꯖꯜꯂꯛꯑꯦ ꯍꯞꯇꯥ ꯑꯅꯤ ꯍꯦꯟꯖꯜꯂꯛꯑꯦ ꯃꯔꯤꯒ ꯁꯨꯖꯜꯂꯛꯑꯦ ꯍꯥꯏꯔꯒꯗꯤ ꯁꯝꯊꯤꯡ ꯏज ꯔꯣꯡ ꯑꯗꯨ ꯑꯣꯏꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯅꯟ ꯍꯤꯂꯤꯡ ꯑꯜꯁꯔ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯝꯕ꯭ꯔꯨꯁꯦ ꯌꯥꯝ ꯄꯥꯈꯠꯅꯩ ꯁꯝꯕ꯭ꯔꯨꯁꯦ ꯑꯩꯁꯦ ꯆꯥꯎꯈꯠꯂꯛꯑꯦ ꯑꯗꯨ ꯀꯩꯅꯣ ꯀꯦꯟꯁꯔ ꯑꯣꯏꯔꯝꯒꯗ꯭ꯔꯥ ꯀꯥꯏꯅ ꯍꯦꯛꯇ ꯆꯥꯎꯈꯠꯂꯛꯑꯒ ꯀꯦꯟꯁꯔ ꯑꯣꯏꯅꯤ ꯍꯥꯏꯕꯗꯤ ꯅꯠꯇꯦ ꯀꯔꯤꯒꯨꯝꯕ ꯁꯥꯏꯖꯁꯤꯅ ꯁꯨꯝ ꯆꯥꯎꯈꯠꯂꯛꯑꯕ ꯌꯥꯝ ꯍꯥꯀꯠꯆꯕꯗꯧꯅ ꯁꯨꯝ ꯇꯧꯈꯠꯂꯛꯑꯕ ꯃꯥꯒꯤ ꯃꯁꯛꯁꯦ ꯌꯥꯝ ꯊꯨꯅ ꯆꯦꯟꯖ ꯇꯧꯔꯛꯑꯒꯗꯤ ꯊꯨꯅ ꯆꯦꯟꯖ ꯇꯧꯕ ꯍꯥꯏꯕꯗꯤ ꯍꯞꯇꯥ ꯑꯅꯤ ꯑꯍꯨꯝ ꯊꯥ ꯑꯃꯔꯣꯝꯗ ꯇꯧꯈꯠꯂꯛꯑꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯈꯔ ꯆꯤꯡꯅꯕ ꯌꯥꯏ ꯑꯗꯨꯕꯨ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯃꯔꯨꯑꯣꯏꯕꯗꯤ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯆꯥꯎꯔꯛꯄ ꯍꯥꯏꯖꯔꯤꯕ ꯂꯥꯏꯍꯧ ꯇꯧꯕꯒꯨꯝꯕ ꯆꯥꯕ ꯊꯛꯄ ꯌꯥꯔꯛꯇꯕ ꯍꯛꯆꯥꯡ ꯁꯣꯟꯊꯔꯛꯄ ꯂꯥꯏꯍꯧ ꯇꯧꯕꯒ ꯂꯣꯏꯅꯅ ꯀꯃꯟ ꯑꯣꯏꯕꯁꯦ ꯁꯤꯒꯤ ꯃꯌꯥꯝꯁꯤꯅ ꯑꯌꯥꯝꯕ ꯑꯣꯏꯅ ꯁꯤꯝꯇꯝ ꯑꯣꯏꯒꯜꯂꯤ
ꯄ꯭ꯔꯤꯚꯦꯟꯁꯟꯒꯤ ꯃꯇꯥꯡꯗꯗꯤ
ꯄ꯭ꯔꯤꯚꯦꯟꯁꯟꯁꯦ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯕꯁꯦ ꯃꯁꯤ ꯃꯈꯜ ꯑꯅꯤ ꯊꯣꯛꯅ ꯈꯥꯏꯗꯣꯛꯄ ꯌꯥꯏ ꯑꯦꯅꯤ ꯄꯦꯁꯦꯟꯅ ꯍꯪꯕꯁꯦ ꯑꯩꯒꯤ ꯀꯦꯟꯁꯔꯁꯦ ꯂꯧꯅꯕ꯭ꯔꯥ ꯂꯧꯅꯗꯕ꯭ꯔꯥ ꯑꯩꯒꯤ ꯏꯃꯥꯗ ꯑꯩꯒꯤ ꯏꯄꯥꯗ ꯑꯩꯒꯤ ꯏꯆꯤꯟ ꯏꯅꯥꯎꯗ ꯀꯦꯟꯁꯔ ꯅꯥꯏ ꯑꯩꯉꯣꯟꯗ ꯅꯥꯔꯛꯀꯗ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯦ ꯌꯥꯝ ꯀꯃꯟ ꯑꯣꯏꯅ ꯍꯪꯉꯤ ꯃꯁꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯟ ꯃꯣꯗꯤꯐꯥꯏꯑꯦꯕꯜꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯦꯔꯤꯗꯤꯇꯔꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯖꯔꯝ ꯂꯥꯏꯟ ꯃ꯭ꯌꯨꯇꯦꯁꯟ ꯍꯥꯏꯕꯗꯤ ꯑꯩꯒꯤ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯅꯦꯃꯥꯗꯒ ꯑꯦꯟꯖꯦꯂꯤꯅꯥ ꯖꯣꯂꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯅꯦꯃꯥꯒꯤ ꯌꯥꯝ ꯑꯐꯥꯎꯕ ꯍꯣꯂꯤꯋꯨꯗꯀꯤ ꯑꯦꯛꯇ꯭ꯔꯦꯁꯇꯣ ꯃꯥꯒꯤ ꯐꯦꯃꯤꯂꯤ ꯖꯤꯟ ꯂꯥꯏꯟꯗ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔꯒꯤ ꯖꯤꯟ ꯑꯃ ꯂꯩꯔꯝꯃꯦ ꯍꯥꯏꯕꯗꯒꯤ ꯃꯥ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔ ꯅꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯑꯣꯄꯔꯦꯁꯟ ꯍꯥꯟꯅ ꯇꯧꯈꯤꯕ ꯁꯨꯝꯕꯁꯤꯅ ꯖꯔꯝ ꯂꯥꯏꯟ ꯃ꯭ꯌꯨꯇꯦꯁꯟ ꯀꯧꯋꯦ ꯃꯣꯏꯁꯤꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯃꯣꯗꯤꯐꯥꯏ ꯇꯧ ꯉꯝꯃꯔꯣꯏꯕ ꯁꯤꯅ ꯑꯇꯣꯞꯄꯗ ꯂꯩꯖꯈ꯭ꯔꯒ ꯑꯇꯣꯞꯄ ꯐꯦꯃꯤꯂꯤꯌꯦꯜ ꯕꯣꯟ ꯃꯤꯔꯣ ꯐꯦꯂꯔ ꯁꯤꯟꯗ꯭ꯔꯣꯝ ꯀꯥꯏꯅ ꯂꯥꯛꯄ ꯌꯥꯕ ꯑꯅꯥꯕ ꯈꯔ ꯂꯩ ꯌꯥꯝ ꯔꯦꯌꯔꯅꯦ ꯑꯗꯨꯗꯤ ꯑꯩꯈꯣꯏ ꯄꯥꯈꯠꯅꯤꯡꯉꯥꯏ ꯂꯩꯇꯦ ꯑꯩꯈꯣꯏꯅ ꯄꯥꯈꯠꯇꯣꯏꯁꯤꯗꯤ ꯃꯣꯗꯤꯐꯥꯏꯑꯦꯕꯜꯁꯤꯅꯦꯕ ꯃꯣꯗꯤꯐꯥꯏꯑꯦꯕꯜ ꯍꯥꯏꯕꯗꯤ ꯀꯩꯅꯣ ꯑꯩꯈꯣꯏ ꯏꯁꯥꯃꯛꯅ ꯂꯣꯏꯅꯃꯛꯅꯗꯤ ꯆꯦꯟꯖ ꯇꯧꯕꯗꯤ ꯉꯝꯕ ꯇꯧꯕꯗꯤ ꯍꯦꯛꯇ ꯋꯥꯕ ꯐꯥꯔꯁ ꯃꯣꯁ ꯏꯝꯄꯣꯔꯇꯦꯟꯁꯦ ꯇꯣꯕꯦꯀꯣꯅꯦꯕ ꯉꯁꯥꯏꯗꯒꯤ ꯑꯣꯖꯥ ꯃꯌꯥꯝꯅ ꯑꯩꯈꯣꯏ ꯗꯣꯛꯇꯔ ꯃꯌꯥꯝꯅ ꯍꯥꯏꯈ꯭ꯔꯦ ꯀꯃꯟ ꯏꯁ ꯁ꯭ꯇꯤꯜ ꯂꯪ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯔꯦ ꯁꯥꯔꯅꯕꯨꯗꯤ ꯍꯧꯖꯤꯛ ꯍꯥꯏꯔꯦ ꯅꯨꯄꯤꯗꯨꯁꯨ ꯌꯥꯝ ꯇꯧꯈꯠꯂꯛꯑꯦ ꯍꯥꯏꯔꯦ ꯀꯩꯒꯤꯅꯣ ꯃꯁꯤ ꯍꯥꯏꯔꯦ ꯂꯨꯡꯁ ꯀꯦꯟꯁꯔꯁꯦ ꯅꯨꯄꯤꯗꯨꯁꯨ ꯃꯌꯥꯝ ꯑꯃ ꯑꯗꯨꯝ ꯊꯛꯅꯔꯤ ꯍꯥꯟꯅꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯥꯔ ꯃꯅꯤꯄꯨꯔꯒꯤ ꯄꯦꯁꯦꯟ ꯁꯣ ꯃꯦꯅꯤ ꯑꯣꯐ ꯗ ꯑꯣꯜ ꯂꯦꯗꯤꯁ ꯋꯦꯔ ꯁ꯭ꯃꯣꯀꯤꯡ ꯍꯧꯖꯤꯛꯁꯨ ꯑꯗꯨꯝ ꯅꯍꯥꯗꯁꯨ ꯑꯗꯨꯝ ꯃꯌꯥꯝ ꯑꯃ ꯑꯗꯨꯝ ꯆꯠꯅꯕꯤ ꯑꯣꯏꯅ ꯊꯛꯅꯔꯤ ꯇꯣꯕꯦꯀꯣ ꯍꯥꯏꯕꯁꯦ ꯃꯊꯪꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀ꯭ꯋꯥ ꯑꯣꯏꯅ ꯆꯥꯕꯗ ꯇꯣꯕꯦꯀꯣ ꯁꯤꯖꯤꯟꯅꯕ ꯃꯌꯥꯝ ꯑꯃ ꯌꯥꯎꯔꯤ ꯇꯣꯕꯦꯀꯣꯁꯤꯅ ꯋꯥꯟ ꯑꯣꯐ ꯗ ꯃꯣꯁ common leading cause of preventable cancer ne ado itadi ngasi digi hona kaigumba ISTV gi discussion awards bu yengbiriba khudimagna kwa charamba churup thamba any kind of tobacco do ai ngasi digi lokthokre haiba matamda nupadana 50% mukti prevent toba ngamba yai na khanbi yai ado itadi nupi dasu around sarna jo haibi gibda damaina 17 to 20% handaba yai so most important tobacco leisagre mathangda alcohol leire alcohol sidi akhoi gi di chanabi oina mayam not only manipur lam khuding gi ni madunasु cancer ham to hole yam maroi bam tanga haijage madudi kaino obesity se obesity sidi akoi asukimadi yame manipur da so asukimadi yame hujik akoi somda chasi KFC le me somda chasi KFC le pizza hut KFC so many fast food hai base ready made pre cook food to the sahalaga khudak ta pirak banina there are so many antioxidant mathang masai gi chain mayam ma sokhrabnina maduna cancer tholak ba yabage sumati yame aduga marakta akhoi infection jimadi akhoi prevent tongam dre any viral infection gumba say for example covid ekta haijirage covid na raba matung da so many people are having some problem cardiac problem hoy bi lungs problem hoy bi cancer hoy bi kari gino ham tum da virus ki jin jina akhoi gi jin jina changjin raga some kind of defect lakpa yai adoi tari khwai common di akhoi gi hujiki tobacco gumba yu gumba obesity haitare adoi tari obesity bung akthoke haragadi kai to utare exercise obi habne ba exercise haraga ai gym da chalaga yot chana bi habne teba any kind of light exercise 30 minutes per day ngamagadi 5 days in a week habne ba adoi tari 30 days di aina 30 minutes to the yam kuina sangna chatra sudum yare aduga yam kanna gym da chatra sudum yai gym da chatpasina haksangi muscle fazana bani akoigi modeling oiba adum mayam mudi kanai body building mayam lay adubu khwai phabadi simple akoigi exercise ma to wiraba chaba takpujima natural food chabiyo hoiba akoi 3/4 2/3 ki akoigi saruk mari thokbagi yamdrabada ahum gumje natural food chabiyo ba yumda thongba chak chabiyo ba cancer je sukumadik handaba yagani na
physical exercise musa maru were okay ai kanoda khoi Dr. Dhanisor da mulakstige khajigi mayam ma panbigre hajik se khoi gi cancer patients sing da ai khoi gi role of surgery se laigani na khala hitare role of surgery se kya maru oi masine kya mu yana khoi gi sep to bangami masi prevention gi adigi masi gi posit tawro matung da kya mu yamna kan to ko pai haide magi importance se role of surgery se cancer patients da kya maru oi masi matang se
phani haijak sigi answer si hydric mang dai minute amatang tamonil dai supplement ma sam tang tawjage kui ding da aina thengna giba article amada pa ki bani cancer se mayamna hoi yamna dreaded habdi mayamna yamna ki na budi lawi adu ekasu cancer khuding mak ngasi ai kaim tawdana tungraga hayeng ai hogol cancer narame haiba nate situation mayam lay where precancerous lesions labor for example ngasai gi koi gi doctor nilna haibi gi ba tobacco senaragadi tobacco sum chaw mi se ngasi kaim tawm da budu hayeng ai tai cancer narni haiba nate magi khanong manungi unsa da ahongba stage payama lala akana cancer ola kadoine ba adagi atopa example hairaga na akoi gi cervical cancer angang kenogi angang khawgi cancer haiba adagi even breast ki cancer hairisi akoina anamma tamna yamna advanced stage ta khangba yauri karigumba aina thamninga point se viewer mayam gi su kana hongna ba akoi gi screening test mayam leiri cancer si on ringai da aigi haksang da ohongudi lakpa horaba cancer makti on riba sigi timing sida aina screening tawthoga oral examination self breast examination cervical gi pap smear tawriba kholiba akoina screening je tawtho horagadi ngasai gi high risk leiba patient jingji changes lakpadi horaga cancer on ringai da akoina phahoragadi moidadi treatment success yam thina wangadi prevent hogadani amram da haiga adu matang suai supplement tawningi aduga hajiki Someone has a question, surgery, role of surgery in cancer treatment. Surgery as a modality, cancer management, every step the role. Ahan bada cancer diagnosis, same matam. Diagnosis ama koi na yauna bo hona basi the surgery role lay. Akoi gi biopsy lauba haibadi nari balena zeki masa kantong na ba piece macha ama lau thoga test lauba haibasi. Yamna minor surgery ama dadum changa doni. Maju surgical step amani. Khudam oina haibada khoi gi leida khanau da ko chimban manung da cancer ji form to leiragadi male hairaga ju magi biopsy ma tawraga hek proof tawdri makhaidi magi proper staging yaroi duini proper management plan da yaroi duini ona piece macha ma lokthoga either thangna ka ga lokthopo oibe yai yetum kitang pawe yetum na thilaga lokthopo oibe yai magi diagnosis form tawgadoini adu ju procedure macha amadi oiribani adagi next step tana koi gi staging tumor gi staging da surgery gi role khara lei khudam oina haijara bada ovary dagi horpa angang khaw dagi horpa cancer ji sometimes akoi key hole haina base laparoscopic assess tawraga manung da yenga adu da staging da mateng pangba adu gi chu surgical role khara lei aduga treatment gi da akoi na changjal agadi surgery ji either tumor ji cancer ji cure tawrage haibagi target ta surgery gi role lei aduga tumor si atai gi treatment chathaba yana na bagi for example yamna chawba tumor si ina debulking surgery tawraga magi volume du handhala kanda maduda mai yai bagi treatment ji pisan ba natraga na chemo treatment ji thara kanda proper cure mangam ghina bagi mateng oiba debulking surgeries haiba leiri tumor si completely akhoi lokthokpa yarani hairaga di mana khwaidagi important oiba treatment gi method ama orakadoini madu lokthokra matungda nariba patient ji gi cure oiba ama achieve tawba haibase surgeries na khwai chawba role ma play tawgidoini aduga amuksu akoi gi doctor anil ngasai breast cancer ngasai familial genetic mutation haiba ma panbi hibado akoi gi famous Hollywood actress Angelina Jolie gi breast surgery tawraga lokthoki haibasina koina risk reduction surgery kawisina mu haibadi patient amada already magi body da magi genetics da magi e da hayeng future da cancer tholokba yabagi mutation ji already khangtu oga leiraba high risk leiraba adu itagadi mangon da cancer form tawba ngaidana magi risk si handhana gi damakta breast cancer gi risk legana breast si operate tawraga handagi loktho hoba adagi thyroid da ju rare di oi akoi gi medullary thyroid carcinoma haiba makhan khara leiri yamna high risk mutation leiramagadi even akoina thajabada di waba ko angang si chahi ama sudringai da magi thyroid si operate tawra loktho hogadabani haiba khara leiri common natamina mayamna toini tadaba advain tawdana genes ta mutation leiraba hayeng kona future da cancer narakpagi chance ti wanga leiraba hoji hoji ti naba natriba adugum patient sing da ju koina cancer oiraktana bagi risk reduction surgery haiba surgery role advain to role khara ju leiri aduga aroibada cancer si akoina palliative intention da haibadi surgery tawraga cure di yaroidaba but still mangon di relief yamna chawna piba yagadaba magi quality of life to improve tawba yagadaba palliative surgery haibagi akoigi kaino amasu leiri film amasu leiri khudam oina haijarabada kanagumba intestine da chakhau da ko tibong thrin da cancer nare phunjang gidana khong hamba yadre chaba thakpa yadre na khallasi cancer je treatment tawraga ju curing amaro haiga ju somehow aina bypass to biradi magi chaba yana ba khong hamba yana ba ina lambi am piragadi magi lemhori ba punsi du quality leina masadu problem leitana ma hingba yagadin again tawdana cancer ge treatment da right from diagnosis tagi horaga staging magi treatment gi surgery na main pambai oiraga su natraga mana helping atai pambai sena ba yana ba gi help to bo oirasu natraga na cure to bo yararoi haba mi dasu magi quality of life to improve tawna ba problem to decrease to bina ba koina palliative surgery haba sigi mayam je role doina ma dum lai
okay ji haidi okoi gi surgery gi part se yam thina maru oire haitare
every step the surgery gi contribution adum
aduga kanona doctor okoi gi curable oiba oidabai matang se soida makal khara adum laibra sigum makal sina adum cure oi aduga masigum masino cure oide ka haibi gi pot aduga masum lai thengna gi bra kamai toi masi
akoina absolutely magi se cure tawba yarani natraga yaroi haiba maktudi lepa wai tawdabu as a thumb rule akoina cancer any cancer ma diagnose to guma tamda magi proper staging ma tawrise staging sidagi magi sigi stage de leiraga di akoina cure to bugi chance wang leiri aduna cure to bugi method de changjanji haiba bu oirasu sigi stage si yaugi tar na akoina cure haiba si achievable hadi achieve to ya ba target oidre aduna mangonda nadana ba problem thoktana ba punsi sangtokna ba magi mateng oina akoi honarasi samlagna haijaraga di curative intention haiba mane palliative intention haiba mane auna stage ta mayamna khangbiri jingai stage 1 dagi horaga stage 4 phok lai early stage hairaga na stage 1 2 sini stage 1 2 dadi any sort of cancer da koina cure tawba most commonly khuding bakki haiba nate anambada stage 1 2 da lairaga di cure ngam gini haiba stage ama oiribnina yamna magi cure gi khalaga koi treatment tokselakani stage 3 da su kitang di advance oire adu ega ju cure koi target tawba yari stage 4 da mayamna layman na thajari stage 4 bu hairaga di cure tawba yaro haba che chap heta lepsin nei bako masida aina mayam gi doubt mai clear tawjaram ge stage 4 khuding mak cure tawba yaro haba oide cure tawba warani haba di oi stage 2 wangabnina adubu stage 4 da su akoina 4A 4B 4C haidana ahum thona khaidu iba karigumba cancer je solid organ cancer ne haijari blood cancer gina kitang tongale ko solid organ cancer da stage 4C hairaga di horaiba jaga dagi already blood ta santokre haibane aduna it has become a systemic disease ai lungs ki ni ai stomach ki ni haiba yade madi blood ta santomina every organ da cancer je santokra bane ba aduna stage 4C yoga di cure yadre habisima clear cut doctor na dum hairani first hex staging khangbaga 4A ga 4B ga di difficult oijaraga ju akhoi patient gi chahi matang duna masagi kalliba chang duna ai gi treatment hindu thaba yani haiba taraga di surgery na bu oire natraga combination of atai modalities yoksel laga bu oire cure tawbagi attempt tawba yari haina haining
okay next I would like to discuss with Sir Bhattacharya. Sir, we all know the burdens given by this dreaded disease in the world. So do we need to join our hands to fight against this dreaded disease? How this world is fighting against this dreaded disease, and what is the progress of researchers, medical practitioners, and anybody who work in this field?
So this is very important issue. Cancer is a disease where cancer research only benefits the patient. Cancer research is very easily converted from bench to bedside. Bench means where laboratory scientists do research on the cancer cells and find out how cancer cell is behaving, what are the pathways the cancer cell is making resistant against a particular medicine, and how cancer cell is still growing. So this research is going on by the MSc, PhD scientists, research associates and team in the laboratory of the universities. But immediately when some molecule or some pathway is discovered, that is taken out from the laboratory to the bedside by the pharmaceutical companies. So what they do, their research and development wing immediately converts that research into a particular drug product, and that drug is tested by the clinicians in clinical trial. So we call in cancer care, clinical trial is the best medicine for any patient, because what the existing treatment guidelines are there, they are all going to fail in some time or other in majority of the patients. So what is left with you? That now cancer cell is behaving in a bizarre way. It is not working with the standard chemotherapy drugs or targeted therapy drugs or immunotherapy drugs. So what to do? So to find out whatever the scientists have discovered from the laboratory, let us try it on a human being in an ethical manner. So there are standard guidelines called Good Clinical Practice, GCP guideline. So following that guideline, any academic institute can start research,
Yeah.
or any medical institute can start research based on that, or the pharmaceutical companies design a trial and there is a multicentric trial, like the trial is going on in entire nation or in the entire world. We have participated in such trials where centers are there in USA, in Spain, in Colombia, or in Panama City, and in Calcutta, Delhi, Bombay, Madras. Why not in Imphal? Imphal can also be made a clinical trial research center for the clinical trial. And there are good universities, central universities, who are doing active research in the bedside, in the laboratory. So their knowledge, what they are gathering for the particular cancer, one I want to mention is the nasopharyngeal cancer, which is very common in the northeast India, especially in Manipur. So that cancer is not that common in rest of India. So it is a unique problem of Imphal or Manipur area. So that cancer, if the research starts in the universities, we give the cells, they do research on those cells, and what they get, we implicate it on clinical trial with ethical clearance. Then only it can join hands. So America has the American Association of Clinical Research, Cancer Research, AACR, where all scientists and clinicians join hand together to fight the common enemy.
Yeah.
Common enemy is cancer. So we, with the patient, with the scientists, researchers, we join hand to fight the common enemy, cancer. And that should be our resolve on the day. By participating in cancer research, we can close the gap further. Because in cancer research, when a new drug is tried on a clinical trial basis, patient need not to pay any single penny. Entire funding is done by the research organization, if it is a government research, academics oriented research, by a academic organization initiation, or by the pharmaceutical company. And all side effects and everything is documented. So it is best, once your standard treatment fails, one should be happy to participate in clinical trial, and that's how we can close the gap much further.
Okay, that you are saying the world is fighting very hard against this disease. Sir, on the other hand, please you tell something about the immunochemotherapy and its benefits.
It is a very important issue. When cancer care started, it all started with the surgery worldwide. Charaka, Shusruta, all had the great surgery benefit for the cancer. That time cancer word was not known. It was called Karkata Roga. It was like a crab. It doesn't leave the body. So they named it in our ancient language. So surgery was well known. So that is from thousands of years. Then only in 1910, the radiation therapy has come into being. So there was a ray which will attack the cancer cells and it will kill the cancer cells. Now that's how it started. So radiation therapy is only 110 years old. And medical therapy for cancer, it is further younger. It only started in 1940s. During the World War, some chemical agents which were used for chemical weapon, mustard gas, and that was found accidentally that killing cancer cell as well. It was like a penicillin discovery. That guy had fever and his bread was stinking with fungus, and fortunately that fungus was not a poison. It was a blessing. It was the first antibiotic called penicillin. So similarly, cancer drug also was discovered like that. So that is now cyclophosphamide and all agents in that group are from nitrogen mustard. And another agent they tried to discover, because one Indian called Iyala Prakata Subbarao, he was a scientist in Lilly's laboratory. So he was doing research. He was a medical doctor in British India. So he was not allowed to do practice in USA. So he was working in a laboratory of pharmaceutical company and doing research on the folate pathway, folic acid, one vitamin. And accidentally he discovered that folic acid synthesis can be stopped by a particular agent. So he came running to a doctor called Dr. Farber. He was a pathologist. Every day he was seeing patients are dying, young children are dying due to acute lymphocytic leukemia, and he has to do autopsy for all of them. So when his emotions came, he requested that Indian doctor Subbarao that please help me by giving your powder, I will put in some patient. So that time big pediatrician will not allow to a pathologist. You are supposed to do only autopsy. So he put a staircase below chamber for those experimental treatment, and that's how cancer care started. But all those drugs were like a carpet bombing because they are chemotherapy. So they will not decide, they will kill only cancer cell. All dividing cells of the bodies are attacked by chemotherapy drugs like hair cells, so hair cell falls, oral mucous cavity, so there is ulcers and pains in the mouth, bone marrow, it is affected because it is also dividing cell. So all three areas are affected by chemotherapy. So that is why it is so dreaded for the patient. They are always afraid for chemotherapy. But what is immunotherapy? Immunotherapy is a particular form of targeted therapy where an immunoglobulin will attack the particular cell where that antigen is present. This immunoglobulin is called antibody, and cancer cell is having the antigen. So when this cell will attack the cancer cells, it will not attack the other dividing cells. So it is a specific target. You have to find out by analysis of the tumor specimen, by immunohistochemistry, by molecular analysis. So if you find that target present, then you use that antibody. Like in earlier days when people had tetanus, so we had anti-tetanus vaccine. And there is anti-tetanus immunoglobulin. These immunoglobulin will attack on the cells of tetanus and they will kill them. So patient will not have tetanus. It is not primary prevention, it is a secondary, it is the treatment of tetanus. Similarly, anti-rabies vaccine was there and anti-rabies immunoglobulin was also there. But those immunoglobulins were from horse's serum. Like insulin, earlier it was from the porcine insulin. Now it is monoclonal antibody. So genetic engineering has really revolutionized the cancer care, and now we have monoclonal antibodies prepared by recombinant DNA technology, which are very effective. Like we all started with rituximab, then went on. And remember, all cancer chemotherapy, cancer chemotherapy and immunotherapy, they all started their journey with discovery in the hematological system, because blood is a easily available tissue. What our Dr. Dhaneshwar was telling, ki for a solid tumor, you have to take out the tumor tissue to test.
Piece of the tumor.
Piece of the tumor. But for the blood, it is available immediately. So there is a blood cancer. It is easily available and its treatment is also effective.
Thank you very much, sir. Tamo Dhaneshwar Damulak sige. Tamo kano se akoi gi hajik se cancer gi laina si kanagumba miwe khardi masigi stigma discrimination gi pose kharad nappuga chapudung thengna ba haitare sisna maram warakanda masisu factor am warakanda masada akoi gi early detection tobagi kano si laitaba screening tobagi pose laitaba sina maram warakanda masina narakna bagi maram ama uibasi adum yorongadu male haitare adun swagi matangda aikoina financial constraint labor corporation me pose khakta natana mi khujing masina aikoi hajikti akoi early detection is free of cost abo haji dum pina ba yauri haitare ana sigum bagi mayam se sida aikoina advocacy adoga magi education kan awareness kum se masi henna mathau tabra sigum masi hande hangi harigadi aikoina sigum masi jo so lambil amani dum khana ba yaru tamu kamaina mayam tholok na basi karmain to we
ai sigi question sigi answer pidring ai point khedang hapchauge discussion je phajan tawre ahambada khoi gi cancer prevention gi matang da khoi gi Dr. Anil yam phajana haibigre ado ai latest khoi study report muna hairise khoi cancer chamai manungda kunthra di ngasai gi tobacco sinaba aduga weight hena nohenba ko adigi red meat chaba alcohol sinaba si myamsina 30% am oigre another 30% am di khoi gi infection se human papilloma virus hepatitis HIV sini ching bisna 30% cover to hai aduga around 10% am na khoi genetically khoi mediated way si upai chu leita modify to way oi daba aduna aina haijabe athadi cancer chamai manungda around 60-70% di akhoi na modify to yai akhoi na ngakthok pi yai aduna masi akhoi will power ma change ba ko aduna cancer ji akhoi na ngakthok ngamdre haibadi khoi khanbi adre aduna akhoi khutta lei 70% di akhoi si mai point thamninge adu second point da akhoi gi surgery gi role si yam chawre ngasai doctor dhane so haibi khre ko aduga stage 4 da ngasai role si cure na traga mai quality of life si fund bi adeba cancer patient ji akhoi na stage 4 da leire ma kana roina thambasi adeba aduna akhoi quality of life ki matter ma lakoni na surgery role so am leire aduga cancer khara amadi mai organ si gi oiba mai unique tumor biology gi matungina cure khara waba le khara thengna isi kitang size kitang chawkhalaga di cure oiba waba makhan se khoi pancreatic cancer kai se si khara boy brain tumor gumba ko aduga khoi mesothelioma kaina khoi lungs ki mathak leba cover gumba sta to cancer lei cancer khar de lei moi jinge early ti de to ji khwai aduga moi si tumor biology je kitang aggressive oiba aduna cancer se cure oiba wabi wani moi ji loine cure oiba ya dabra habi na te ko aduna early detection gi role sim phajan leire aduga ngasai Dr. Sivasis na nasopharyngeal cancer si akhoi gi manipur am common oiba disease na se aina chahi tara gi mamangda trangi mamangda ai senior professor mayang so khoi tanarga si matang sa khoi article mayam idna khotna honai ai samak 2013 da Department of Biotechnology Government of India na khoi award am bidna ai पृथ्वी की ख्वाइदगी वांगबा कैंसर इंसिडेंट नेसोफेरिंजियल कैंसर ख्वाइ वांगमुसी साउदर्न चाइना गोंगजौ सिद ओय अदुगी यूनिवर्सिटी सिदा संजेसन यूनिवर्सिटी आई ट्रेनिंग खरा आई माइक्रो आरएनए खोगी सिना ट्यूमर मार्कर ओइना बायो मार्कर ओइना तरोगा नेसोफेरिंजियल कैंसर सि डिटेक्ट तोबु याब्रा अर्ली डिटेक्ट तोबु याब्रा हाइबगी खोइ रिसर्च तो खोबाइ खचचरुइ हला मतुंग आई यस मणिपुर यूनिवर्सिटी की डिपार्टमेंट ऑफ बायोटेक्नोलॉजी की डिपार्टमेंट के पुल्लगा खोइसी प्रोजेक्ट खरा तवी प्रोजेक्ट तो दा खोइना थेंगै EBV virus की DNA copy सी अखोई E दा यामने याव सिंग सी नेसोफेरिंजियल कैंसर सी लाकुई चांसंग वांगबा अदुना अखोई की पेपर खर दा अखोई ना हाइग्रे इप्सिन virus हाइबा महिक सी की DNA copy सी E दी यंगथोकांदा मागी कट ऑफ पॉइंट दुदगी वांखत पसिंग सी कैंसर नेसोफेरिंजियल कैंसर लाकुई चांसंग वांगी अदुना हाइबा मी सिंग जी स्क्रीनिंग दा एम्फेसाइज तोबा ग्रुप नि गाइना अखोई स्टडी तोदना मथंग पुथोखरे अदुना नेसोफेरिंजियल कैंसर सी अखोई सिगोइनि याम लई चुम्मी मान हाइबिदो अदुगा अखोई मसीगी रिसर्च सिसु दुम आई वखंदा हुजुजिक डिपार्टमेंट ऑफ बायोटेक्नोलॉजी दम तथब्राने खली अदुगा अरोइबा हुजुकी क्वेश्चन माइंगो दंग बिखिबा अर्ली डिटेक्शन एंड द स्क्रीनिंग से यस पॉसिबल ओय समना द सर्वाइकल कैंसर वुम कैंसर आई बाना बसी अखोइना पेप स्मीयर सि तौरकांदा चही तरुक तरे वालिंग द खंगमंगमे ओय कदोरे से मागी ब्यूटी ऑफ द पेप स्मीयर इज टू get that information that cancer can come after 6 years haibsine ko adu gap ma lenge mark sida khoina kai gi tobi abage se matamam piri si screening ni ko adu si gi mark sida khoina patient ji toina screening check se tokthokanda stage 0 da or stage 1 du far gadi ma dum 100% ne na khoina cure ne lobi ai ko adu cervical cancer the womb cancer da screening gi role am chawre adigi amana prostate cancer si chai yankai humpu sujal agadi कोई प्रोस्टेट कैंसर की चांस वांखले अदुना कोई एंजाइम प्रोस्टेट स्पेसिफिक एंटीजन गाइना ब्लड टेस्ट तोबा अदि अल्ट्रासाउंड सिनरगा प्रोस्टेट की साइज येंबा ना चिंबा टेक्निक खर लई सी तरगा प्रोस्टेट कैंसर से जो स्क्रीनिंग तोबा याई अदु यामना कॉमन ओइबा डिजीज कोई ब्रेस्ट कैंसर से मसी स्क्रीनिंग सी अमरु ओइ मसी स्क्रीनिंग से कोई मेमोग्राफी तोई मरु ओइना सही यांखै निफुमंगा यांखै सुजलागदी मेमोग्राफी तरगा कोइना याम फजना कानाबा स्क्रीनिंग से तोबा याई अदुगा सही खर नौरगदी अखोइना अल्ट्रासाउंड गुम तरोगा अखोइ पेशेंट से चाही नौबनिना रेडिएशन की एक्सपोजर की अखोइ 1000 टू पिनिंग दबनिना चाही 40 की मया द लेबा जासी अखोइ अल्ट्रासाउंड गुम तरोगा खरा दुम चेक तवी अदुगा फैमिली की हाई रिस्क लेबा ग्रुप हाइबदी मागी मदर नत्र माई सिस्टर मा breast cancer nagre and haira gadi masi high risk group oibnina akoi chai ni phu suruga suma mammography tok do yati adigi sometime MRI se kushine MRI breast se ad sometime akoi MRI gi breast se sina yawi adu head and neck cancer ki matang de akoi doctor dhane sor oncol surgeon hena khangbire ma practice dum fajana tawbani akoi gi sumbagi patient head and neck ki matang da akoi gi early detect tawbagi visual inspection tawga khanong manungi any changes pre malignant condition na chingba nga sai haibi gibdo madu loina khanguragadi khoi cancer se dum na pharaga dum cure bi ai bako tabu mi sing thine awareness bum changba aduna tummaga khoi leiba yadi khoi awareness leiba tabani khoi loina khangba tabani prevention is better than cure na mayam haina rise masi sida ina
amodu ga basi khoi na cancer ka pan ba mi se ki bagi pot ama kaksu leitab na ti haitare so I guess aran bu oibra kramai
masi 1980 to 3 adwaida cancer survival se 5 years survival se around 50% or meba head and neck cancer example ado 2003 da di 66-70% oireba aduna hanigi concept da khoi gi hana cancer si moina late stage lying hiba adigi infrastructure chudaba khulai chudaba adi protocol leitaba adigi hojiki targeted therapy mayam la eko multimodality therapy la abani na cure de se enga chaije gi 2003 da 66% ai bu hojiki hengal amane ba ko si concept si leitaba dagi hanigi oiba wakal ondu da cancer bu naradi radiation bu torodi patient sire kaina khanba ma leba ko tasingadi radiation torkan da patient sire na khalise khoi patient stage 4 da la kan da magi symptom phanaba magi bleeding phanaba chikpa phanaba khoi radiation ka pi bu da patient du gi stage 4 oi gi yam thengba makhan 4 si ga nga sa haibi gi bu do adum bo oi bagi magi life span du tien bagi tanja du da he lei gi da du da radiation toru bu da gi ma si sire khole kaina khanbu gum ma lakpa adu bu curative patient mayam da khoi radiation je torim ne ba breast cancer da khoi samna da breast si pulop lok thokui mohota machet nam khatang lok thoga mai whole breast si preserve toroga radiation piraga adum phajana cure oi biare hadi mi du mai body image nu mangdre haijari ba adu sumbagi idea khoi knowledge ma'am si kitang wat padagi stigma ma leibani adu hojik ayam ba khoi public si awareness lae aini sum khanjabada laiba hospital da laiba patient sing ji moina khoi da hangpa question ji thaina chei tarai mamang da hangpa adu manadre hojiki stage 4 si अखोइना स्टेज 4 पेशेंट द थाइन अखोइना खलम कंसेप्ट से था तरु खतनी माई सर्वाइवल से नखोइ यामना रबली हाइजर हाइरम बदो हुजी याद रे लंग कैंसर द स्टेज 4 दा चई एनी हिंग बियोरी ओम हिंग बियोरी हाइबदी हुजी अनु टारगेट थेरापी न चंग मयाम पुंजलक पुसे अच्छी माइने थमजन
आइदे मा होम मयाम लाई हाइ
होम मयाम लाई
आई डॉक्टर अनिल लाग अनिल खोइगे ब्लड कैंसर से सिगी मतंग से मणिपुर गो नि कमाइन तोई मसिगी ट्रीटमेंट सिना कमाइन पी खोली मसिगी नाबै जांग कमाइन तोई मणिपुर गी
samdamna hijrage matam jule selector banina ngasai ge koi doctor dhane sorna hai khiba stage 4 da di blood di khene hebedo ngasai blood asidi aigi anywhere aigi khut ta yobu ga khong di yobu ga chamana rabane ba aduna akoina for example lymphoma ma ekta hijrage DLBCL have lymphoma ma khalabne even stage 4 oirabok ta ma 70% chance of cure dum leiri ba aduna haibadi karigumba solid malignancy da di stage 4 ga hadi sarna hoji sahi ni mu hingba yai gan hairi adai ta di blood malignancy gi khena bakhr lei yamdi aggressive oiba aduga laibok faragana pura cure oibagi chang se blood malignancy da sum yang khole even akhoi sarna sa hai gi study mem je blood gi amana sum hudoki hebedo manipur gi oina di akhoi gi blood malignancy mem je akhoi ai gi nakan de lengjin bi bai sar se ai gi di ozani rims da khoina tameng da akhoi oza oina lek pani moi se duna doctor tomcha ge sarin di bor hoi moi mem na loi to biraga lenga ga mathang mathang aduga blood ki sina kitang to khai bu da sar hoi mem na anil nang la ni nang khar khar gi ngon ai na khar khar sum kitang hena yenge jenims da khoina yeng ai se hoji phok da average da chahi ma da yam dar da 200 patient mukti lae masidai da angang na around 50 mu oraga adult na 150 oi अदैदा अखोइना हाइजेनिंग मसे अंगांग द क्वाइ कमन ओइबा कैंसर जिना एक्यूट ल्यूकेमिया द ALL जे ओइगले अदो ALL गी लाइबग याम फबदी नारे हाइरगजु चामगी बिनुंग द 80-90% फबियै मसिदैदाइना याम चोकथोक चनिंग बम तंग हाइजेनिंग मदुदी अखोइना कैंसर नारदी हेक्ता सिरद्रा न पाकलम बदो होजिकती अखोइ जेनिम्स द आई होजिक थोलकपा चही तरे चुरकले एम्स की थोलकपदा चही तरे हेना सर्वाइव तो पेशेंट 80-90% योक्सलकले अदुन हाइबदी होय रिलैप्स तोरकपा फरक्तबा पेशेंट अमा निदी दुम यावी अखोइ जु थवा याम नोइते अदुबु फगिबा मयाम दुगी खल्लगदी अदुगी मयाम अमदो सारनसु मयाम अम लाइंग बिबी और आइगी फर्स्ट टू पेशेंट जे अमना अखोइ की रेडिएशन पीबने स्क्रोटल रेडिएशन पीबने सार मसामंग न पीबीबने कईगिनो अखांग खाव अखांगी अखोई इसिंग खावगी मपान थोखमगी इसिंग खावसिदा यावरगदी मोइजे हेंग कोना तुंगदेम हलकली गाना सारीबानी तानरगा पीगिबने अंगांग अनि दो हुजिक चही तरेट हेनग्रे हुजिकबो केम तौदरी अदोय तारगदी असुगमदिक नुंगाय अंगांग दा चामगी मनुंगदा 80-90% क्योर तौबे याबसे मणिपुर दसु याय मपालम दसु याय अदुदी ट्रीटमेंट से मणिपुर गा मपान गा याम खेनाब्रा हरगदी इवन पैसा खरा हेना पाइबा मीना हेना लाइबक फरे कईगिनो इन्फेक्शन की चांग संदरे पैसा नुंसा पाइद्रबोक जेनिम्स लायंगली मथंग दा खितंग चही यामागना मोइगी सक्सेस रेट से खितंग हंदरे से अराउंड 80% योगदे 70 to 80% हाइरे अदुगा चही जे कुंथ्रा मु हेलागदी मोइ परसेंटेज मु 40 to 60 हाइ सिन ALL गिनिको चही खरा यामागना कोइ लुकीमिया दा AML हाइबजना खरा कमन ओय AML जिदी लाइबग याम थीरगदी फतबजु दुम यावे फबसु दुम यावे अदुना मोइगी फबगी चांगसे ऑल ओवर द वर्ल्ड अराउंड 40 to 60% फब यावी अखोइ मणिपुर गे नदी आई विल से अराउंड 40% मुक्ति दुम फगिबा पेशेंट मैम हम लई आइगी अदुम आइबु यामना नुंसिबा पेशेंट मैम मा दुम फग्रब मतुंग दा दुम चही खुदिंग दुम लाए हुजिकसु अदगी दी एयर अखोइगी क्रू केबिन क्रू गा खनगिबा कनो बो यावरे अदुगा केबिन क्रू माना अखोइगी मैम दा सक्सेस स्टोरीज लीरगा इन्फ्लुएंसर गा ओइले रंबगी माना को नेंगोंदा वरी लिरक पे यावे हाउ सी फेल्ट अदुगा मैम दो अदमाइ तौदना अखोइगी कैंसर हारगा ब्लड कैंसर हारगा अखोइसे हेक्ता पाखन रोइसेबा ब्लड कैंसर दा याम साथीबा एग्रेसिव ओइबा याम थुना लायंग दबा यादबा मा नत्रगना तबली लाकपा हुजिक ममिंग दी पंजररोइगे चही अमनी की ममांगदा नारे पुक्सु नाबा मीजु कारे गन तोरगा हुजिक खतंग लाकपा केम तोकदे चही जु हुमद्रा मरफु सुरे अदो हुमद्रा मरफु सुरे जु लायंगा गा मा अदुम फदोरिबा
यामना हेने किचन
yes चही तारा अमगा हिंगदी चही मोगद्रा बुक्सु गिदोरेबा अदुना हेबदी अखोइना ब्लड कैंसर याम साथीबा लाइबक थीबु जु खरा यावी अदुबो अखोइ वखंदा सिनेमा ड्रामा दा आई थिंक मीडिया दा अखोइना जु हाइजेनिंग बसे सिनेमा ड्रामा दा करिगुम थवाइ नुवाइतबा सिनेमा क्रिएट तौनबो होनबदा ब्लड कैंसर नारे है खाएगा लगा कैंसर नारे है खाए लगा अखोई व्यूअर मैम की ऑडियंस मैम की इमोशंस तो लो नबगी होनबो मतमदा कैंसर नारे हरगा हेक्ता पाखलन बजे मसिन जो म ओइब्रा नाइ हाइजे
ओके या पसन तबेल आया कोई डॉक्टर दिनेश वदा लाक्सेगे कोई कनोसी हेड एंड नेक सर्जिकल ऑन्कोलॉजी की कोई की ट्रीटमेंट की कनोसी हजिक कदाबो मागी कनोसी लइ हजिक
फनी हाइजेगे मणिपुर की केनोसिदा हंगी
मणिपुर की दा हाइबिरसु मणिपुर दा फंगबा फैसिलिटी सिंग जो हाइबिर यारे
हेड एंड नेक सी अखोई की फॉर एग्जांपल इन एरिया जे इन डिफाइन तौजरगदी कॉलर बोन लैरी बसे सीबोक कोक तगी हौरगा सीबोक से हेड एंड नेक लाई एक्सेप्ट द ब्रेन जे हेड एंड नेक ता चिंगी दुग मागी ट्रीटमेंट पाइबदी मोस्टली न्यूरोसर्जन पाइगनी एक्सेप्ट ब्रेन अतई की एनी लोकेशन दा चिंबान मनुंग दा कनाव मनुंग दा मिट दा नातोन दा साइनस दा नेजोफेरिंग्स थ्रोट की वोकल कॉर्ड की को अदगी चिंजा उतोंग हौरफम की कई लेरियो मैम से लोइना पुंसे लगे हेड एंड नेक ना हाइबनी अदुगा मागी प्रेवलेंस मागी कैम कॉमन ओगे हागदी लोइना पुंसे लगदी वन ऑफ द कॉमनेस्ट कैंसर नॉर्थ ईस्ट ना हेनबो कॉमन ओइनी ऑल ओवर इंडिया जो वन ऑफ द कॉमनेस्ट साइट नि कैंसर हौरफम की अदुगा मागी ट्रीटमेंट सी कदाई फावबो खोइना मागी इंफ्रास्ट्रक्चर से कदाई फोक लेरगे हायरगदी ngасai अखोई की सर धनेश सुरन सो हाइबी की बदनी कैंसर की बी इट हेड एंड नेक बी इट एनी अदर ऑर्गन एनीवेयर नाउ मतमदा आईगी सर्जरी लोइना ngमनी नत्रगना मई याबसिन लोइ ngमनी हाइबा दुगम कइमत लेते मसी टीम गेम नि मयाम पुन्ना सब्जेक्ट खुदिमकना कंट्रीब्यूशन तौरकांदा बेस्ट आउटकम से लाप ngमगदोइनी अदु रफली हाइजो मतमदा हेड एंड नेक की नारक कैंसर सिंगदी with some exception anambada karigumba surgery tawraga complete removal yaragadi adugumba patient singda magi final result si yamna positive oina yamna phana cure rate wangna lei on surgery is the backbone of treatment head and neck kidi aduga adu phana hairaga su surgery dun loi yare ategi modality mating tadre habadi nate actively supported by radiotherapy combination ni mase team game ne ina haijagi dungai सिंगल सानब याव पोट नते हौजिक अखोइना मणिपुर की लेवल दे येंगगदी मागी सर्जरी दा चंगिबा खुजु खुलाई चंगिबा खोलिबा मयाम से ऑलमोस्ट एज पार्ट टू एनी अदर नेशनल इंस्टीट्यूट अखोइ की बबिना एवाई इम्फाल की लैरे नै हाइजनिंगी अदुगा ꯌꯥꯝꯅ ꯃꯌꯥꯝꯗ ꯑꯩꯅ ꯁꯤꯌꯔ ꯇꯧꯅꯤꯡꯕ ꯌꯥꯝꯅ ꯅꯨꯡꯉꯥꯏꯕ ꯄꯥꯎ ꯑꯃ ꯍꯥꯏꯔꯒꯗꯤ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔ ꯑꯦꯁ ꯁꯆ ꯃꯅꯤꯄꯨꯔꯗ ꯌꯥꯝꯅ ꯀꯣꯃꯟ ꯑꯣꯏ ꯑꯩ ꯏꯁꯥꯃꯛꯁꯤ ꯗꯦꯜꯂꯤꯗ ꯄ꯭ꯔꯦꯛꯇꯤꯁ ꯇꯧꯖꯔꯝꯃꯤ ꯒꯨꯋꯥꯍꯥꯇꯤꯗ ꯃꯇꯝ ꯈꯔ ꯂꯩꯔꯝꯃꯤ ꯏꯚꯟ ꯑꯩ ꯁꯥꯎꯠꯇ ꯆꯦꯟꯅꯩꯗ ꯃꯇꯝ ꯈꯔ ꯂꯩꯔꯝꯃꯤ ꯑꯗꯨ ꯃꯌꯥꯝꯁꯤꯒꯤ ꯌꯦꯡꯉꯨ ꯃꯇꯝꯗ ꯅꯣꯔꯠ ꯏꯁꯠꯁꯤ ꯊꯥꯏꯔꯣꯏꯗ ꯗꯤꯖꯤꯁ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔꯒꯗꯤ ꯌꯥꯝꯅ ꯀꯣꯃꯟ ꯑꯣꯏ ꯏꯚꯟ ꯅꯣꯔꯠ ꯏꯁꯇꯁꯨ ꯃꯅꯤꯄꯨꯔꯅ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯀꯣꯃꯟ ꯑꯣꯏ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯧꯖꯤꯛ ꯗꯦ ꯇꯨ ꯗꯦ ꯄ꯭ꯔꯦꯛꯇꯤꯁꯇꯁꯨ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔꯁꯤ ꯌꯥꯝꯅ ꯇꯣꯏꯅ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯩ ꯑꯣ ꯄꯤ ꯗꯤꯗ ꯊꯥꯏꯔꯣꯏꯗ ꯀꯦꯟꯁꯔꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯕꯦꯁꯤꯛ ꯃꯥꯒꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏꯕ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯍꯥꯏꯔꯒꯗꯤ ꯁꯔꯖꯔꯤꯅꯤ ꯕꯠ ꯄꯦꯁꯦꯟ ꯈꯔꯗ ꯁ꯭ꯇꯦꯖ ꯈꯤꯇꯪ ꯋꯥꯡꯕ ꯄꯦꯁꯦꯟ ꯈꯔꯗ ꯑꯩꯈꯣꯏꯅ ꯑꯥꯏꯑꯣꯗꯤꯟ ꯊꯦꯔꯥꯄꯤ ꯍꯥꯏꯕ ꯄꯣꯠ ꯑꯃ ꯂꯩ ꯍꯧꯖꯤꯛ ꯐꯥꯎꯕ ꯃꯅꯤꯄꯨꯔꯗ ꯃꯁꯤꯒꯤ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯦ ꯑꯦꯕꯥꯏꯂꯦꯕꯜ ꯑꯣꯏꯗꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯦꯟꯇꯔꯗ ꯌꯥꯝꯅ ꯊꯨꯅ ꯑꯩꯈꯣꯏ ꯍꯧꯅꯅꯕ ꯇ꯭ꯔꯥꯏ ꯇꯧꯔꯤ ꯑꯦꯛꯁꯄꯦꯛꯇꯦꯗꯂꯤ ꯕꯥꯏ ꯅꯦꯛꯁ ꯃꯟꯠ AOIꯗ ꯕꯥꯏ ꯅꯦꯛꯁ ꯃꯟꯠ ꯑꯩꯈꯣꯏ ꯁ꯭ꯇꯥꯔꯠ ꯇꯧꯕ ꯌꯥꯔꯦ ꯍꯥꯏꯕ ꯁꯦꯝ ꯁꯥꯖꯔꯒ ꯂꯩꯔꯤꯕꯅꯤ ꯍꯧꯖꯤꯛ ꯐꯥꯎꯕꯒꯤꯗꯤ ꯑꯥꯏꯑꯣꯗꯤꯟ ꯊꯦꯔꯥꯄꯤ ꯗꯔꯀꯥꯔ ꯇꯥꯕꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯑꯣꯄꯔꯦꯠ ꯇꯧꯕ ꯂꯣꯏꯔꯀꯥꯟꯗ ꯑꯅꯛꯄ ꯖꯒꯥ ꯒꯨꯋꯥꯍꯥꯇꯤꯗ ꯑꯣꯏꯔꯦ ꯀꯣꯜꯀꯇꯥꯗ ꯑꯣꯏꯔꯦ ꯗꯦꯜꯂꯤꯗ ꯑꯣꯏꯔꯦ ꯑꯩꯈꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯦ ꯂꯧꯅꯕꯒꯤ ꯔꯦꯐꯔ ꯇꯧꯔꯝꯃꯤ ꯑꯗꯨꯒꯤ ꯂꯦꯀꯤꯡ ꯑꯃ ꯂꯩꯔꯝꯕꯁꯤꯁꯨ ꯋꯤꯗꯤꯟ ꯑ ꯚꯦꯔꯤ ꯁꯣꯔꯠ ꯄꯤꯔꯤꯌꯠ ꯑꯣꯐ ꯇꯥꯏꯝ ꯑꯩꯈꯣꯏ ꯑꯗꯨꯃꯁꯨ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠꯇ ꯍꯥꯞꯆꯤꯟꯖꯔꯅꯤ ꯑꯗꯨꯒ ꯃꯌꯥꯝꯒꯤ ꯁꯦꯕꯥ ꯇꯧꯕꯗ ꯃꯄꯨꯡ ꯐꯥꯅꯕ
ꯅꯨꯡꯉꯥꯏꯕ ꯄꯥꯎ ꯑꯃꯅꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯣꯀꯦ ꯃꯇꯝꯁꯤ ꯂꯣꯏꯁꯤꯜꯂꯛꯄꯅꯤꯅ ꯑꯩ ꯑꯔꯨꯕꯁꯤ ꯑꯩꯈꯣꯏ ꯇꯥꯃꯣ ꯗꯅꯦꯁꯣꯔ ꯁꯔꯃꯗ ꯂꯥꯛꯆꯒꯦ ꯇꯥꯃꯣ ꯀꯩꯅꯣꯅꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯃꯦꯔꯤꯀꯥꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯑꯩꯈꯣꯏ ꯕꯕꯤꯅꯥ ꯈꯥꯕꯤꯁꯣꯏꯒꯤꯁꯤꯅ ꯃꯇꯝ ꯆꯍꯤ ꯈꯔꯒꯤ ꯃꯃꯥꯡꯗꯒꯤ ꯍꯧꯅ ꯑꯩꯈꯣꯏ ꯃꯅꯤꯄꯨꯔꯗ ꯃꯈꯜ ꯀꯌꯥꯒꯤ ꯀꯦꯟꯁꯔ ꯅꯥꯔꯛꯄ ꯃꯤꯑꯣꯏꯁꯤꯡꯁꯤꯅ ꯃꯇꯝ ꯑꯃꯗ ꯁꯦꯜ ꯌꯥꯝꯅ ꯇꯤꯡꯉꯒ ꯑꯩꯈꯣꯏ ꯃꯇꯝ ꯃꯥꯡꯅ ꯃꯤ ꯁꯨ ꯃꯊꯧ ꯇꯥꯔꯒ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯄꯥꯟ ꯂꯝꯗ ꯑꯩꯈꯣꯏ ꯄꯨꯟꯁꯤ ꯍꯤꯡꯅꯕꯒꯤꯗꯃꯛ ꯆꯠꯅꯔꯝꯕ ꯑꯗꯨꯒꯨꯝꯕ ꯁꯤꯆꯨꯋꯦꯁꯟꯗꯨ ꯀꯟꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯃꯦꯔꯤꯀꯥꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯕꯕꯤꯅꯥꯁꯤꯅ ꯌꯥꯝ ꯆꯥꯎꯅ ꯊꯧꯗꯥꯡ ꯂꯧꯕ꯭ꯔꯥ ꯍꯥꯏꯅ ꯈꯟꯖꯩ ꯍꯥꯏꯕ ꯇꯥꯔꯦ ꯑꯗꯨꯅ ꯍꯧꯖꯤꯛꯁꯤ ꯁꯤꯒꯨꯝꯕ ꯑꯆꯧꯕ ꯊꯧꯗꯥꯡ ꯑꯃ ꯂꯧꯕꯤꯔꯤꯕ ꯁꯤꯗꯩꯁꯤꯗ ꯇꯥꯃꯣꯁꯨ ꯇꯧꯕꯤꯔꯤꯕꯅꯤ ꯑꯗꯨꯅ ꯍꯧꯖꯤꯛ ꯁꯤꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠꯁꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯂꯝꯁꯦ ꯂꯥꯌꯦꯡꯕꯗ ꯑꯩꯈꯣꯏ ꯀꯌꯥꯃꯨꯛ ꯌꯥꯝꯅ ꯃꯥꯒꯤ ꯀꯩꯅꯣꯁꯤ ꯂꯩꯔꯦ ꯀꯟꯇ꯭ꯔꯤꯕ꯭ꯌꯨꯁꯟ ꯃꯥꯒꯤ ꯑꯦꯆꯤꯞꯃꯦꯟꯁꯤꯡꯁꯤ ꯀꯗꯥꯏꯐꯥꯎ ꯂꯩꯈ꯭ꯔꯦ ꯑꯗꯨꯒ ꯀꯔꯤ ꯇꯧꯒꯦ ꯍꯥꯏꯅ ꯇꯥꯃꯣꯒꯤ ꯋꯥꯈꯜꯗ ꯂꯩꯕꯤꯔꯤ ꯍꯥꯏꯕꯒꯤ ꯃꯇꯥꯡ ꯁꯥꯏꯗ ꯊꯝꯕꯤꯔꯒ ꯉꯁꯤꯒꯤ ꯇꯣꯄꯤꯛꯁꯤꯒ ꯃꯔꯤ ꯂꯩꯅꯅ ꯇꯥꯃꯣꯒꯤ ꯁꯥꯏꯗꯒꯤꯁꯨ ꯃꯌꯥꯝꯅ ꯄꯤꯕꯤꯅꯤꯡꯕ ꯃꯦꯁꯦꯖ ꯑꯃꯇꯪꯒ ꯊꯝꯕꯤꯔꯝꯃꯣ
ꯍꯧꯖꯤꯛ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏ ꯃꯌꯥꯝꯁꯤ ꯑꯃꯦꯔꯤꯀꯥꯟ ꯑꯣꯟꯀꯣꯂꯣꯖꯤ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯁꯤ ꯑꯩꯈꯣꯏ ꯂꯥꯏꯕꯛ ꯐꯕꯅꯤ ꯑꯁꯨꯛ ꯆꯥꯎꯕ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯠ ꯑꯃ ꯑꯩꯈꯣꯏ ꯁꯤꯗ ꯑꯃ ꯂꯩꯕꯁꯦ ꯑꯗꯣ ꯍꯧꯖꯤꯛ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏꯅ ꯄꯦꯁꯦꯟꯁꯤ ꯃꯊꯪ ꯑꯩꯈꯣꯏ ꯇꯤꯝ ꯑꯣꯏꯅ ꯂꯥꯌꯦꯡꯉꯛꯄꯁꯤꯗ ꯑꯌꯥꯝꯕ ꯄꯦꯁꯦꯟꯁꯤ ꯗꯤꯜꯂꯤ ꯌꯧꯈ꯭ꯔꯀꯥꯟꯗ ꯀꯣꯟꯅ ꯍꯜꯂꯛꯄ ꯌꯥꯎꯔꯦ ꯑꯗꯨꯝ ꯑꯩꯈꯣꯏ ꯁꯤꯗ ꯂꯥꯌꯦꯡꯖꯔꯒꯦꯅꯀꯣ ꯑꯗꯣ ꯕꯣꯝꯕꯦꯗꯒꯤ ꯑꯗꯩ ꯑꯦꯝꯁꯇꯒꯤ ꯄꯦꯁꯦꯟ ꯃꯌꯥꯝ ꯑꯃ ꯒꯨꯋꯥꯍꯥꯇꯤꯗꯒꯤꯁꯨ ꯍꯜꯂꯛꯄ ꯌꯥꯎꯏ ꯑꯗꯣ ꯃꯣꯏ ꯈꯪꯕ ꯍꯧꯔꯛꯑꯦ ꯃꯣꯏ ꯏꯟꯐꯣꯔꯃꯦꯁꯟꯁꯦ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯁꯦꯟꯇꯔꯁꯤꯗ ꯀꯦꯟꯁꯔ ꯑꯌꯥꯝꯕ ꯑꯩꯈꯣই ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯇꯧꯔꯦ ꯑꯗꯨꯒ ꯀꯦꯟꯁꯔ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯔꯀꯥꯔ ꯑꯣꯏꯗꯕ ꯀꯦꯁ ꯃꯌꯥꯝ ꯑꯃ ꯃꯄꯥꯟꯗ ꯆꯠꯇꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯇꯝ ꯃꯥꯡꯕ ꯄꯩꯁꯥ ꯃꯥꯡꯕ ꯑꯗꯒꯤ ꯃꯦꯟ ꯄꯥꯋꯔ ꯃꯥꯡꯕ ꯃꯌꯥꯝꯁꯤ ꯑꯩ ꯈꯔꯗꯤ ꯑꯩ ꯃꯁꯤ ꯍꯟꯊꯔꯕ꯭ꯔꯅ ꯑꯩ ꯈꯟꯖꯔꯦ ꯑꯗꯨꯒ ꯄꯦꯁꯦꯟ ꯈꯔ ꯑꯃꯗꯤ ꯍꯧꯖꯤꯛꯁꯤ ꯍꯥꯏꯔꯤꯕ ꯄꯦꯁꯦꯟꯁꯤꯡꯗꯨꯅ ꯑꯃꯨꯛꯁꯨ ꯑꯇꯣꯞꯄ ꯄꯦꯁꯦꯟꯗ ꯏꯟꯐꯣꯔꯃꯦꯁꯟꯁꯤ ꯄꯤꯔꯒ ꯃꯣꯏꯅ ꯑꯗꯨꯝ ꯔꯤꯐꯔ ꯇꯧꯔꯒ ꯄꯦꯁꯦꯟ ꯂꯥꯛꯄꯁꯤ ꯍꯧꯔꯦ ꯑꯗꯣ ꯍꯧꯖꯤꯛ ꯑꯣꯏꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯇꯤꯝꯗ ꯑꯩꯈꯣꯏ ꯏꯇꯠ ꯇꯠꯇꯅ ꯑꯩꯈꯣꯏ ꯃꯤꯇꯤꯡ ꯇꯧꯖꯩ ꯑꯩꯈꯣꯏꯒꯤ FD ꯑꯩꯈꯣꯏ ꯁꯥꯔ ꯃꯖꯨꯝꯗꯔ ꯌꯥꯝ ꯐꯕ ꯑꯅꯧꯕ ꯌꯥꯝ ꯗꯥꯏꯅꯥꯃꯤꯛ ꯑꯣꯏꯕ ꯑꯃꯁꯨ ꯂꯥꯛꯑꯦ ꯃꯥꯁꯤ ꯑꯗꯨ ꯃꯤꯇꯤꯡꯁꯤ ꯇꯧꯔꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯁꯤ ꯈꯟꯅꯩ ꯇꯤꯝ ꯑꯣꯏꯅ ꯑꯩꯈꯣꯏ ꯄꯨꯟꯅ ꯀꯩ ꯇꯧꯕ ꯌꯥꯒꯦꯁꯦ ꯃꯥꯒꯤ ꯌꯥꯝ ꯐꯖꯕ ꯑꯃꯅ ꯑꯩꯈꯣꯏ ꯐꯤꯗꯕꯦꯛꯁꯤ ꯃꯥ ꯐꯖꯅ ꯇꯥꯏ ꯑꯗꯨ ꯌꯥꯝ ꯑꯦꯛꯇꯤꯞꯁꯨ ꯑꯣꯏ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏ ꯈꯟꯖꯔꯤꯁꯤ ꯑꯦꯋꯥꯔꯅꯦꯁꯁꯤ ꯑꯩꯈꯣꯏ ꯍꯥꯟꯅꯁꯨ ꯑꯗꯨꯝ ꯇꯧꯔꯤ ꯄꯕ꯭ꯂꯤꯛꯀꯤ ꯑꯦꯋꯥꯔꯅꯦꯁ ꯑꯩꯈꯣꯏ ꯀꯦꯝ ꯍꯦꯜꯊ ꯀꯦꯝ ꯇꯧꯕ ꯈꯣꯠꯄ ꯁ꯭ꯀ꯭ꯔꯤꯅꯤꯡ ꯑꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯨꯝꯕ ꯃꯦꯗꯤꯌꯥꯗ ꯀꯩꯗ ꯏꯟꯐꯣꯔꯃꯦꯁꯟ ꯄꯤꯕ ꯀꯦꯟꯁꯔꯒꯤ ꯃꯔꯝꯗꯀꯣ ꯁꯤ ꯆꯠꯊꯕꯒ ꯂꯣꯏꯅꯅ ꯄ꯭ꯔꯦꯛꯇꯤꯀꯦꯜ ꯑꯣꯏꯅ ꯈꯔ ꯑꯃꯨꯛ ꯑꯣꯏꯅ ꯑꯩꯈꯣꯏ ꯐꯤꯖꯤꯀꯦꯜꯂꯤ ꯑꯩꯈꯣꯏ ꯗꯣꯛꯇꯔ ꯃꯌꯥꯝꯁꯤꯅ ꯄꯦꯁꯦꯟ ꯃꯌꯥꯝꯁꯤ ꯄꯕ꯭ꯂꯤꯛ ꯃꯌꯥꯝꯁꯤ ꯍꯦꯟꯅ ꯎꯅꯔꯒ ꯋꯥꯁꯤ ꯐꯖꯅ ꯇꯥꯟꯅꯔꯒ ꯃꯇꯝꯒꯤ ꯔꯨꯇꯤꯟ ꯑꯣꯏꯕ ꯃꯑꯣꯡꯒꯤ ꯄꯦꯔꯣꯗꯤꯀꯦꯜ ꯑꯣꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯦꯜꯊ ꯏꯚꯥꯂꯨꯌꯦꯁꯟꯒꯨꯝꯕ ꯑꯩꯈꯣꯏ ꯇꯧꯕ ꯑꯗꯨꯒ ꯀꯝꯃꯨꯅꯤꯀꯦꯁꯟꯁꯤ ꯌꯥꯝ ꯂꯥꯏꯍꯟꯕ ꯃꯈꯜꯒꯤ ꯀꯝꯃꯨꯅꯤꯀꯦꯁꯟ ꯍꯥꯏꯇꯥꯔꯦ ꯗꯣꯛꯇꯔꯒ ꯄꯦꯁꯦꯟꯒ ꯒꯦꯞꯁꯤ ꯀꯝꯃꯨꯅꯤꯀꯦꯁꯟ ꯂꯩꯇ꯭ꯔꯤꯁꯤꯒꯤ ꯑꯩꯈꯣꯏ ꯀꯝꯃꯨꯅꯤꯀꯦꯁꯟ ꯍꯦꯟꯅ ꯁꯣꯔꯠ ꯑꯣꯏꯍꯜꯂꯒ ꯍꯦꯟꯅ ꯏꯟꯐꯣꯔꯃꯦꯁꯟꯁꯤ ꯍꯦꯟꯅ ꯈꯪꯍꯜꯂꯒ ꯑꯩꯈꯣꯏ ꯇꯥꯟꯅꯕ ꯌꯥꯕ ꯃꯑꯣꯡꯗ ꯇꯧꯔꯀꯥꯟꯗ ꯑꯩꯈꯣꯏ ꯄ꯭ꯔꯦꯛꯇꯤꯀꯦꯜ ꯑꯣꯏꯅ ꯑꯋꯥꯠꯄ ꯏꯟꯐ꯭ꯔꯥꯁꯇ꯭ꯔꯛꯆꯔ ꯈꯔꯁꯨ ꯑꯩꯈꯣꯏꯒꯤ ꯄ꯭ꯔꯣꯀ꯭ꯌꯨꯔꯃꯦꯟ ꯑꯣꯔ ꯄꯔꯆꯦꯁ ꯇꯧꯁꯤꯟꯕ ꯑꯗꯨꯒ ꯍꯧꯖꯤꯛ ꯍꯥꯏꯕꯤꯈꯤꯕ ꯔꯦꯗꯤꯑꯣꯑꯦꯛꯇꯤꯚ ꯑꯥꯏꯑꯣꯗꯤꯟ ꯀꯣ ꯏꯚꯟ ꯕꯣꯟ ꯃꯦꯔꯣ ꯇ꯭ꯔꯥꯟꯁꯄ꯭ꯂꯥꯟ ꯇꯧꯕꯒꯤ ꯑꯩꯈꯣꯏ ꯚꯤꯖꯟꯐꯥꯎ ꯂꯩꯔꯤꯕ ꯃꯐꯝꯅꯦꯕ ꯑꯩꯈꯣꯏ ꯁꯤꯁꯦ ꯍꯧꯖꯤꯛ ꯑꯗꯨꯁꯨ ꯌꯥꯎꯅ ꯂꯣꯏꯅ ꯑꯩꯈꯣꯏ ꯗꯤꯕ꯭ꯂꯞꯃꯦꯟ ꯋꯥꯔꯛꯁꯤ ꯆꯠꯊꯔꯤ ꯑꯗꯨ ꯑꯩꯒꯤ ꯋꯥꯈꯜꯗꯗꯤ ꯇꯤꯝ ꯋꯥꯔꯛꯁꯤꯒꯤ ꯁ꯭ꯄꯤꯔꯤꯠꯁꯤ ꯑꯩꯈꯣꯏ ꯁꯤꯒꯤ ꯁ꯭ꯄꯤꯔꯤꯠꯁꯤꯗ ꯁꯨꯝ ꯆꯠꯂꯒꯗꯤ ꯅꯣꯡꯃꯗꯤ ꯑꯩ ꯃꯁꯤꯅ ꯅꯣꯔꯠ ꯏꯁꯀꯤ ꯑꯣꯏꯕ ꯅꯣꯠ ꯑꯣꯟꯂꯤ ꯐꯣꯔ ꯃꯅꯤꯄꯨꯔ ꯅꯣꯔꯠ ꯏꯁꯀꯤ ꯑꯣꯏꯕ ꯁ꯭ꯇꯦꯠ ꯃꯌꯥꯝꯁꯤꯒꯤꯁꯨ ꯑꯣꯏꯕ ꯌꯥꯝꯅ ꯔꯤꯐꯔꯦꯜ ꯑꯣꯏꯕ ꯔꯤꯐꯔꯦꯜ ꯁꯦꯟꯇꯔ ꯑꯃ ꯑꯣꯏꯅꯦꯅ ꯑꯩ ꯊꯥꯖꯩ ꯑꯗꯣ ꯄꯕ꯭ꯂꯤꯛꯇ ꯑꯩꯅ ꯃꯦꯁꯦꯖ ꯑꯃ ꯄꯤꯖꯅꯤꯡꯉꯤ ꯀꯦꯟꯁꯔ ꯍꯥꯏꯕꯁꯤ ꯆꯨꯝꯃꯤ ꯃꯌꯥꯝꯅ ꯑꯍꯥꯟꯕꯗ ꯀꯦꯟꯁꯔ ꯅꯥꯏ ꯍꯥꯏꯕꯗ ꯏꯃꯨꯡꯁꯤꯗ ꯌꯥꯝꯅ ꯑꯋꯥꯕ ꯅꯨꯡꯉꯥꯏꯇꯕ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩ ꯑꯩꯈꯣꯏꯁꯨ ꯑꯟꯗꯔꯁꯇꯦꯟ ꯇꯧꯖꯩ ꯑꯗꯨꯕꯨ ꯀꯦꯟꯁꯔ ꯈꯨꯗꯤꯡꯃꯛ ꯍꯦꯛ ꯅꯥꯕꯒ ꯁꯤꯕꯗꯤ ꯅꯠꯇꯦ ꯑꯗꯨꯅ ꯀꯦꯟꯁꯔꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯥꯕ ꯃꯇꯝꯗ ꯂꯣꯠꯁꯤꯟꯕꯤꯒꯅꯨ ꯉꯟꯅ ꯂꯥꯛꯄꯤꯌꯨ ngana laaba kanda khoi ngasai gi haibi giba government na piriba facility financial support me andu phajina tanarga counseling phajina toroga akhoi gi center se leiba akhoi gi khuju kulai khoi gi facility me am si toroga patient si kanna ba se khoi honor ba khoi pamjei aduga stage 4 oili haraga patient ma khoi gi lying no thamba si tobiginu hayeng stage 4 oijaraga su patient si ngasai gi magi quality of life si phanaba magi mana hayeng magi end part matam si da nuaina magi ingna leijanabagi akhoi policy ma tawdabi yadeba aduna cancer si stage 4 oigo su lying daba tawbiganu aduga maruina hoji cancer prevention go iba ngasai mayam khanagi bado cancer 60% di minimum khoi sana thon daba ya cancer ne logjai aduna tobacco product alcohol ade red meat kumba ko adi physical exercise phajan tawba weight am helandaba aduga mana maching phajan chaba wahi phajan chaba aduga ayamba khoi hepatitis kumba sumba infectious oiba virus ki oiba mai matai sidagi khoi ngak thong noba vaccine thaba khopa mayam ji honaba aduga maruina immunotherapy no hojik laise hakchangi immune ji kallagadi khoi cancer ji changmung amdena adunu bu hida oina puthorabani ani radiation da chu radio immunotherapy na ma layeba ko khoi yes akhoi radioactive isotope si masai immune gi antigens da cancer antigens da masai gi antibody ma hap kharga mana tanaraga na pudoini cancer se da napakanda masai gi radioactive isotope na re thoga se cancer particular cell do haturimne and immunotherapy is not only masai gi chemotherapy or masai hibi gi ba doctor sibase hibi gi se rojam chawi adun hakchang ji immune ji phanaba yam exercise jam toba health jam phaba adu wakhan jam positive energy oiba wakhan jam khanmam change mayam dai chi haijaningi aduga kibiganu akhoi na ngamba service akhoi mayam gidam ki ba dijeli
adunga je tamu kanan ningba akhoi mayam ji lei adu matam se akhoi je kitang akak na bani na ai ngasi gi matang se tension jage aduga asin matam kai to pira ling bere ba khoi kai khumna zerba Dr. Anil Irom, associate professor department of medicine Jennings MD DMC clinical hematology aduga tamo Dr. Dhaneswar Sharma senior consultant radiation oncology AIO Babina Specialty Hospital aduga respected sir Dr. Sivasis Bhattacharya senior consultant medical oncology AIO Babina Specialty Hospital amasung ekoi kai kamazeba Dr. Dhaneswar Naurem consultant head and neck surgical oncology AIO Babina Specialty Hospital ngasigi panelist maribak ISTB gi maike digi thagat perform doksari loina ngasigi damakdri ISTB gi discussion or matang aswade tension jari meyang tabi mayam pun makusu amukane kurim jari